Hi guys, am I audible? Good evening, guys. Okay, hi. So, am I audible? Hi guys, am I audible? Good evening, guys. Just a minute. Okay, hi. Okay, okay. So, am I audible, guys? Am I audible? Yes, I will check this. This one. What is this? Fine. Okay, fine. So, good evening, guys. Okay, I think it's audible. Okay, what we will do here is that, so we have welcome to this, first of all, to this NEET PG sprint session, physics wala NEET PG sprint section 2023. So we are going to have 2 day class, actually 2 day session. So today and tomorrow we have session, and each day we are going to cover all the topics. Both the days combined together, we are going to cover all the topics, and I will go chapter wise. Okay, previous year questions only, past questions, and for NEET exams I will go chapter wise. We will go. Is it fine? Is it fine? So we'll go chapter wise. Chapter wise we'll go. Just answer it. Answer, guys. Yes. So I am from near Chennai. Okay, fine. Shall we start? Yes or no? Okay, fine. Yes. So we'll start. Okay. We'll see here. Question: Human Development Index does not include. We'll go first with chapter of concept of health and disease. We can go. We will start with the topic Human Development Index does not include. Yes. So what should be the source? Okay, so Human Development Index does not. We have some 40 questions for today, and we are going to discuss all these questions, actually. All these questions along with the topic, not just questions. What is the answer, guys? Okay, fine. Okay, all of you are writing. Excellent, doctors. Excellent. And Human Development Index, so answer what you said is right. That is B. Okay, life expectancy at the age of 1 year. Okay, fine. So first, what does this include? This is PQLI. So this measures, what does it measures? It measures quality of life. It measures quality of life. Human Development Index measures quality of life. So what comes here in Human Development Index? What comes here? So it includes, first we will see what is PQLI. PQLI means Physical Quality of Life Index. Physical Quality of Life Index. I'm going to write Physical Quality of Life Index. So this also measures quality of life. It includes 3 parameters. What are the 3 parameters? It includes, you can remember, like ILL1. I stands for infant mortality rate. I stands for infant mortality rate. L stands for literacy rate. Okay, L stands for literacy rate. L1 stands for life expectancy at the age of 1 year. Life expectancy at the age of 1 year. Life expectancy at the age of 1 year. So we can remember like this: ILL1, infant mortality rate, literacy rate, and life expectancy at the age of 1 year. Okay, fine. Now, so this also measures quality of life. This is for a country, for a state, anywhere we can do this. This is where anywhere we can do it. Okay, fine. For example, if you take Kerala, Kerala is having very high PQLA. But the question, what does the question states? Question is related with, what is the question related with? The question is related with HDA, Human Development Index. This also measures quality of life. It includes 3 parameters. What are the 3 parameters? One is, first is life expectancy at the age of 1 year. Sorry, at birth. Okay, HDA is life expectancy at birth. Okay, at birth. At birth. Am I audible, guys? Yes or no? Am I audible? Life expectancy at birth. Second, per capita income. Per capita income. Second is per capita income. Per capita income. Third, we are going to use knowledge. Third, we are going to use knowledge. Okay, knowledge in terms of, okay, mean years of schooling. 2 parameters. Knowledge in terms of mean years of schooling. Knowledge in terms of mean years of schooling. Second is, what is the second one? First one is knowledge. Second is expected years of schooling. Expected years of schooling. Expected years of schooling. Okay, fine. Yes. Now tell me some questions that is related here. Okay, for example, which country is taken as standards, guys? Which country is taken as standards for life expectancy at birth? Suppose you want to calculate for HDA for India. So which country is taken as standards? Okay, which country is taken as standards for life expectancy at birth? Yes, which country is taken as standards? Yes, standard for life expectancy. Okay, for HDA, which country is taken as standards? Okay, for Japan. Okay, for life expectancy at birth, it is Japan, guys. It is Japan. What about per capita income? Which country is taken as standards for per capita income? Yes, per capita income, which country is taken as standards? That means these people are earning more. Which country? Not Denmark, doctor, not Denmark. For life expectancy is Japan, is okay. Okay, we are talking about per capita income. Norway is the rank for HDA. We are talking here overall rank. We are talking here on this one, per capita income. Okay, per capita income. Yes, this is per capita income is Qatar. Okay, per capita income is Qatar. Not US. US also you can see beggars. US also you can see beggars. Okay, fine. So now mean years of schooling, it is Czech Republic. Okay, mean years of schooling, it is Czech Republic. Okay, excellent. All of you answering well. Excellent, guys. Excellent. Okay, this is Human Development Index. So Human Development Index is scale between, the scale for Human Development Index ranges from 0 to 1. Okay, the scale ranges from 0 to 1, where 0 is the best performance, 0 is the worst performance, and 100 is the best performance. Okay, fine. One more indicator we can see. What is DALI means what? Come on, answer this, guys. DALI. What is DALI means what? Okay, DALI means what? Yes. Please answer this. What does DALI? DALI means what? Okay, what does DALI? DALI corresponds to what? Yes. DALI means disability adjusted life years, guys. Disability adjusted life years. This is DALI. DALI means disability adjusted life years. Okay. So DALI includes what? Okay. DALI means what? DALI includes what? DALI means, okay, DALI includes what? Disability adjusted life years. So it includes 2 parts. Years of life lost. It includes years of life lost plus years of life lived with disability. How many years you lived with disability? Okay, how many years? Okay, so how many years you lived with disability? It includes both, guys. DALI includes both. Okay, so DALI, what does DALI indicates? DALI indicates disease burden. Okay, excellent. All of you answering very well, guys. Okay, DALI indicates what? DALI indicates disease burden. Okay, disease burden. Can you tell me for which condition DALI will be more? Can you tell me which condition DALI will be more? DALI will be more. For which condition DALI will be more? For which condition? Okay, tell me some conditions where there is more DALI. For which condition? Okay, DALI will be more for non-communicable diseases. Okay, cardiovascular disease. Okay, mental health. For those conditions, DALI will be more. Okay, fine. Next. What is QALY? Can anyone, before going to the next question, we'll see what is QALY. Okay, what is QALY? Okay, leprosy also you have DALI more. More. Okay, fine. What is QALY? Anyone can tell me what is QALY? Yes. QALY means quality adjusted life years. Quality adjusted life years. That is QALY. Okay. QALY means quality as a treatment. What does it mean? It means number of years of life. Number of years of life added by intervention. So suppose you have a treatment is there. How many extra years the person was able to live? That is QALY. QALY means number of years of life added by intervention. Okay, fine. Added by intervention. Okay, fine. How many extra years of life? How many extra years of life they were able to live? That is QALY. Okay, fine. Suppose there is a treatment, cancer is there. Without treatment, the person dies at 50 years. Suppose there is a cancer is there. Cancer. Without treatment. Okay, so without treatment, the patient dies at 50 years. 50 years. Okay, fine. Without treatment, by intervention. With treatment, the person dies at 60 years. How many extra years gained actually? 10 years. 10 years he has gained. 10 years. How many extra years he has gained? 10 years. Okay, so our treatment as a doctor, we are working to increase QALY and reduce DALI. Okay, am I clear? More QALY and we want to reduce DALI. Okay, fine. Am I clear? Shall I go to the next question? Okay, shall I go to the next question? Okay, it's more exam oriented, guys. More exam oriented. Okay, we will finish. Don't worry about it. Exam oriented. Shall I continue? Yes, I need some answers before going into this. Yes. Okay. Which are the following is not a utilization rate? Next question. Okay, able to follow it, guys? Okay, fine. Which are the following is not a utilization rate, guys? Not a utilization rate. What is utilization rate means what? What is utilization rate means? Answer it. That means utilization means service is available. Service available, whether people are using it or not. Okay. So how much percentage of them are using it or not? What is the answer here? What is the answer? Some of you are answering A, D. Okay, fine. Excellent. Okay, excellent. Okay, fine. So answering it, yes. That means the service is available, using it or not. Okay, what are the utilization rates? Okay, the answer for this question is A. Okay, it is population bed ratio. It's population bed ratio. Okay, fine. So remaining all are, okay, okay, bed occupancy, bed turnover, average, okay, all are utilization rates. Okay, fine. What else is available? Okay, what else is available? Okay, percentage of children percentage of children fully immunized. Percentage of children fully immunized. That means, okay, that is a utilization rate. Okay, fine. Percentage of antenatal mothers, AN mothers I am writing, with 4 checkups. With 4 checkups. Okay. Okay, 4 checkups. Okay, this is service is available whether people are using it or not. Sorry. What is this population bed ratio? Population bed ratio is more of, okay, healthcare delivery indicators. Okay, this is more of healthcare delivery indicators. Healthcare delivery indicators. Okay, fine. Healthcare delivery indicators is more of healthcare delivery indicators. Okay, fine. Okay, so what does this healthcare delivery indicators means? Norms. One is, first is doctor population ratio. Okay, what should be the doctor population ratio? WHO says that how much doctor should be there? 1 doctor for every 1,000 population. Okay, 1 doctor for every 1,000 population. We have this doctor population ratio is there. Okay, second is population bed ratio. Okay, you said doctor nurse ratio. Rocky boy, excellent. Doctor nurse ratio is also okay. Okay, third, population bed ratio. Okay, population bed ratio. Okay, fine. So these are the different ratios we have. These are the different ratios. And what is the population per subcenter? That is also comes here. Can you tell me what is the population per subcenter? Okay, population per trained birth attendant, population per ASHA. Okay, so how much population there should be? A subcenter should be there. Yes. Okay, this is subcenter. A subcenter is not 1:10,000. Sanjay, it's not one. Yes, it is 1:5,000. Normal areas we have 1:5,000. Okay. What about ASHA, guys? What about ASHA? Answer it. What about ASHA? ASHA, how many? Yes. General college versus medical college. Okay, that is not a ratio. Okay, fine. So ASHA should be, there should be 1 ASHA should be for every, okay, 1 ASHA should be there for every 1,000 population. ASHA. These are some other norms, guys. Norms. Okay, fine. So we have seen 2 questions we have seen. One is healthcare delivery indicators we have seen, and utilization rates we have seen. Okay, excellent. Okay, we'll go to the third question. Answer this question, guys. Answer this question. Third question. Okay, fine. Not 800,000 and all. Answer this question. All of the following are examples of specific protection except. We are covering the whole topic. Understand? We are trying to cover the whole topic we are trying to cover. Okay. So answer this question, guys. Answer this question. Concept of health and disease we are covering. Yes. What is the answer for this question? Okay. All of the following are examples of specific protection except. The question is, okay, specific protection except. Okay, fine, except. Okay, fine. So for that, first we have to understand what are the different levels of prevention. First we will understand. Okay, before going further, first we will understand what are the different levels of prevention. Levels of prevention we will see. First, what is primary prevention? What is primary prevention? We will go to this question. C is the answer. We will come back to this. What is primary prevention? Can you tell me what is primary prevention? What is primary prevention? Yes, primary prevention is, okay, before primary prevention, we will see what is primordial prevention. This is, we'll keep it second. What is primordial prevention? Okay, what is primordial prevention? Primordial prevention means what? Okay, primordial prevention is prevention prior to risk factors. Okay, fine. Okay, prevention prior to risk factors. Risk factors के पहले हम prevention करना है. That is primordial prevention. Okay, primordial before risk factors. What is primary prevention? What is primary prevention? Okay, fine. Primary prevention means that means What is primary prevention? Yes, risk factor may be there. We are preventing the disease. Okay, prevention prior to disease. Risk factor may be present. Risk factor may be present. This is primary prevention. Primary prevention. Okay, fine. What is secondary prevention? Secondary prevention. Okay, what is secondary prevention, guys? Secondary prevention. What is secondary prevention? Yes, excellent. Okay, so what is secondary prevention? Awesome, awesome. You are answering well. Okay, so for primary prevention, risk factor may be there. Understand? For primordial prevention, there is no risk factors. There is no risk factor before risk factor. Okay, that means if children are having a very good habits are having, okay, they are having, and you are helping them to maintain it, no harmful habits. Okay, that is primordial prevention. Primary prevention before disease, that maybe risk factor may be there. For example, a person is a smoker, a person is an alcoholic, that we will see. Before development of disease, we are stopping the disease. Okay, that is primary prevention. Okay, fine. Secondary prevention means any action that halts the progression of disease. Okay, action that halts the progression of disease. That means in secondary prevention, the disease have started, guys. Secondary prevention, disease have started. We are trying to stop it at an early stage. Okay, that is secondary prevention. Okay, fine. What is tertiary prevention? Okay, tertiary prevention. What is tertiary prevention? Tertiary prevention, measures to reduce disabilities. Measures taken to reduce disabilities. Okay, so am I clear? So these are the different levels of prevention. Okay, prevention. Okay, these are the different levels of prevention: primordial, primary, secondary, and tertiary. Able to follow this, guys? Yes. Yes or no? Please answer it. Yes. Fine. The next we have some interventions. Interventions we have. Okay. Intervention. What is intervention? Okay. What is intervention? Okay. Fine. Okay. What is intervention? Intervention means any attempt, okay, to interrupt the usual sequence of disease. Okay, you are anything as a doctor, we do intervention. Intervention means any attempt to interrupt the usual sequence of disease. Okay, fine. So we have 5 modes of interventions are there. Okay, first is health promotion. How can you promote health? How can you promote health? Yes. Health promotion. How can you promote health? Yes. Can anyone tell me what you can do to promote health? Health promotion can be done in 4 ways. First is health education. Okay, fine. You go to a group of children and teach them on hand washing technique. That is health promotion. Okay, you are teaching them on hand washing. Okay, so that we are preventing disease. Okay, that is health education. Fine. Second, environmental modification. Examples only they will ask. Okay, in this chapter, if at all they are asking examples. Environmental modification. What do you mean by that? Okay, so there is a water stagnation is there. Okay, you are stopping it. You are closing the water stagnation. Okay, so what disease you are preventing? Environmental modification. Installation of sanitary latrines. Okay, what disease you are preventing? If you are closing that, suppose the water stagnation, what disease we are preventing? Yes, we are preventing vector-borne disease. We are preventing. Excellent, excellent. Third is nutritional intervention. Okay, we are doing nutritional intervention. Where we are doing nutritional intervention? Any program so that the immunity of child gets better and they will not develop disease. Excellent example is midday meals. Okay, you are providing food to the children, their immunity is better and there is no disease. Okay, there is no disease. This is health promotion. The fourth one is lifestyle and behavioral changes. Okay, lifestyle and behavioral changes. Okay, this you already answered it, guys. Behavioral changes. So what comes here? Lifestyle and behavioral changes. What you do? Okay, cessation of smoking. Smoking cessation. Okay, able to follow? Now the question for you guys, okay? Now the question for you is, okay, health promotion comes in which level of prevention? Sorry. Health promotion comes in which level of prevention? Yes, health promotion. Okay, health promotion comes in which level of prevention? Health promotion comes in, excellent, primary prevention. Health promotion comes in primary prevention. Health promotion. Okay, fine. Second, just be actively involved, guys, then only we can learn. Okay, so we learn when we are actively involved, actually. Okay, so try to be write it. Okay, better to write. Anyway, we'll give the notes, that's okay, but if you write, you will remember better. Exam is all about remembering. Okay, so try to write. So try to involve, be in the discussion, so that it will help you to remember better. Okay, fine. Second is specific protection. Can you tell me specific protection examples? Okay, what you do specifically to protect? This is also belongs to primary, guys. This is also belongs to primary, not primordial. Primordial means there should not be risk factor, guys. Environmental modification, nutrition intervention, risk factors will be there. Specific protection. Specific protection is what? Example is specific. Yes, we have is vaccination, guys. Vaccination. One is vaccination. Okay, second, chemoprophylaxis. Okay, even if you are wearing helmet, having a post-nasal drip, causes a little cough. Okay, fine. Sorry about that. So, vaccination, chemoprophylaxis we can do. For malaria, for some conditions we can do. Specific protection. This also comes in which level of prevention? Primary prevention. Wearing mask is example for what? Wearing mask is an example for what? Wearing mask. Yes. Wearing mask is an example of what? Okay. Wearing mask. Okay. Mosquito net is also you are doing something specifically. Iodized salt is also okay. Okay. So wearing mask you are doing specific protection. Okay. That is also specific protection. Okay. Fine. The third one. Wearing mask is primary prevention, but specific protection. Okay, fine. So this is early diagnosis and treatment. Okay, what comes in early diagnosis and treatment? So early diagnosis and treatment, we have any case finding tool, pap smear. Okay, one is pap smear is there. Okay, fine. Okay, we can do fasting blood sugar. Okay, any case finding tool comes in early diagnosis and treatment. Early diagnosis and treatment comes in which level of prevention? Early diagnosis and treatment comes in which level of prevention? Yes. Early diagnosis and treatment, yes, screening, any screening tool. So early diagnosis and treatment comes in which level of prevention? It comes in secondary level of prevention. Okay, comes in secondary level of prevention. Secondary, guys, secondary. Okay, fine. Fourth one is disability limitation. Okay, disability limitation. And fifth is okay, rehabilitation. These both are comes in which level? These two comes in tertiary level of prevention. Okay, tertiary level of prevention. Okay, fine. So is that fine? So we'll go to the question and you answer it. What is the answer for this question? Then we will go to the next one. Okay, we'll see this question first. Okay, fine. Answer this question, guys. All of the following are examples of specific protection except which one will not come? All of the following are examples of specific protection. Which one will not come here? Okay, so the first one is chemoprophylaxis, condom, iodization of salt, all are right. Which one will not come? Yes, it is personal hygiene, environmental sanitation. It is more of which one? Health promotion. It's more of health promotion. Okay, fine. Are you guys able to follow this? Yes, guys. Shall I continue? Okay, fine. Able to follow? Not primordial, guys, not primordial. It is health promotion. Remember, primordial means before risk factors. Personal hygiene, environmental sanitation, if you are maintaining, that's fine. It can be there. Okay, fine. Examples of primordial prevention. Primordial prevention, TK. Okay, there is a student is there. Okay, young kid is there. The child is not having any harmful lifestyles. Okay, the child is having good habits, and you endorse good habits in the child, so that the child is maintaining the good habits. That is primordial prevention before risk factors. Before risk factors. Okay, so for as a doctor, for us it is very difficult. Maybe at young age we can do it before risk factors. Most of the time we will have risk factors. Okay, fine. Yes. Answer the next question, guys. A person who lost his foot in an accident is an example of exercise. If you don't have risk factors, okay. If you don't have risk factors, but if you are obese, you want to reduce weight, then it is okay. Then it becomes primary. If you are obese, you want to do weight reduction, then it is fine. If you are already healthy and you want to do exercise, then it may be primordial. Okay, fine. What is the answer here, guys? What is the answer here? A person who lost his foot is in an accident is an example of what? Okay, fine. This is where disability comes. Okay, so the natural history, it goes like this, guys. Natural history, it goes like this. Okay, first disease will be there. First disease will lead to impairment. Impairment will lead to disability, and disability will lead to handicap. Okay, this is what it is. Okay, person who lost his foot in an accident is an example of what the question is. Okay, first we have to understand terminologies. What is impairment? What is impairment? Impairment means loss of anatomical structure. Loss of anatomical structure. Okay, loss of anatomical structure. It may be loss of anatomical structure or physiological or psychological function. Okay, this is impairment. It may be anything, guys. Okay, it may be anything. Loss of anatomical structure, physiological or psychological function. What is disability? Disability means not able to do a normal activity. Handicap means not able to fulfill social role. Okay, so not able to fulfill social role, guys. Social role. Okay, fine. So the question here is example we will see. Okay, so disease as accident we can take. Okay, so not able to fulfill social role. Impairment means some person lost leg. Okay, lost leg. And disability means normal activity, is not able to walk. Not able to walk. And finally handicap. What is handicap? Handicap means what? Okay, unemployed. He is unemployed. Going to job is a social norm and he was not able to do it. He was not able to do it. And a lost leg. Okay, fine. So able to follow this, guys? So now tell me what is the answer. Based on this, what is the answer? Okay, what is the answer here? Okay, accident, lost leg, not able to walk. Walking is a normal day-to-day activity. He was not able to walk. So the key terminology here is normal activity. Here it is social role, guys. Here it is social role. Able to follow this? Yes or no, guys? Yes or no? Yes. Not disability. Lost is foot only. Lost is foot. Neelam, Dr. Neelam, it's not B. Okay, what is it? Disability, not able to walk. The person is lost his foot only. So foot means what? Yes, it is impairment. The foot means impairment. Okay, fine. So am I clear? Fine. Shall we go to the next question, guys? Able to follow this chapter? This chapter somewhat we can finish. Okay, little bit. We can go to the next topic. The pace is okay. Speed is fine. Yes or no? Speed is fine. Am I do I talk in an understandable way first? Am I talking speedily? Something like that? Anything is there? Otherwise, I will just continue. Okay. Anything is there? You put it in the chat box. Okay, I can answer it. Okay, fine. Yes. Fine. Fine. Okay, fine. So we'll go to this question on, sir, why impairment? The person lost leg. Okay. Dr. BG is the person lost leg. Leg means it's an anatomical structure is lost. Okay, you want me to increase speed? Okay, fine. Okay. We'll do it. Fine. Okay, fine. So what is this Mission Indradhanush? Mission Indradhanush is for what? Okay, Mission Indradhanush is for what? Yes, Mission Indradhanush. Excellent. Mission Indradhanush is universal immunization. Okay, fine. Move fast. Okay, you want fast. Okay, universal immunization. This is a type of question which you put in the exam wrongly, you may not get the seat itself. Okay, this is like that question. Okay, fine. You never should make mistake such type of question. Okay, fine. So we have a vaccination program available. Okay, our program is UIP, Universal Immunization Program. In that we have a component of Mission Indradhanush. Okay, fine. So now I will see. Fine. So we have to vaccinate. Okay, we will see the vaccination schedule. We will see the national immunization schedule. National immunization schedule. We will see, guys. Okay, this is rapid revision, man. We can't explain a lot. Okay, so whenever possible, I will do it. But this is we have to finish it, right? Okay, fine. This is national immunization schedule. We will cover, guys. We will cover everything. Don't worry. So we are starting. Okay, fine. So what comes? It's national immunization schedule at birth. At birth. Listen, we are talking about NEET exam, not INA exam, guys. Not INA exam. INA exam means we need to go deeper, but this is NEET exam. Okay. So what is needed? We'll see. So what are the vaccines we give at birth? What vaccine we give at birth? At birth, what vaccine we give? So we give at birth BCG, OPV 0 dose, and we give hepatitis B 0. Okay, fine. So this is vaccine. Okay, this is BCG. Okay, OPV 0 dose, hepatitis B 0 dose we will give. Okay. So next is at 6 weeks. 6 weeks, what is the vaccine we give? 6 weeks. Okay, 6 weeks we give, what are the vaccines we give at 6 weeks? Okay, fine. We give Penta 1. Okay, Penta 1 we will give. OPV 1 we will give. Okay, IPV 1 we will give. Okay. Rota 1 we will give. And we will give pneumococcal also 1 we will give. Okay, pneumococcal also 1 we will give. This we give it at 6 weeks, guys. 6 weeks. Penta, OPV, IPV. Okay, so we will see. 10 weeks. 10 weeks we will give Penta 2. Penta 2 we will give. OPV 2 we will give. And IPV and pneumococcal we don't give. Rota 2 we will give. Rota 2 we will give. This is 10 weeks. Okay, fine. 14 weeks. 14 weeks we'll give Penta 3, okay, Penta 3, OPV 3, Rota 3, IPV will give second dose, and PCV pneumococcal will give second dose, okay, second dose, okay. Okay, so fine. So this is the national immunization schedule. This is beneficial for first year, okay, TK. Okay, but this is for exam going students, man. Okay, fine. This is more of exam going students. Okay, they are the primary source. Okay, exam going students. I want to make sure that you have some knowledge. Okay, fine. So next is 6, 10, 14, 9 months. We give MR vaccine 1, JE 1, vitamin A we give. Now the PCV booster we give. Now they say some parts of India they have started IPV booster also they have started. Some parts of India. Some parts of India they started IPV booster also they have started. This is at 9 months. 9 months. Okay, fine. Again at 16 to 24 months. 16 to 24 months what we give? We will give DPT. We'll give OPV will give. Okay, MR2, JE2 will give. JE2 will give 16 to 24 months. Okay, fine. Vitamin A we will give, guys. Vitamin A we will give every 6 months. In second year, we will give every 6 months. Okay, till 5 years of age. Okay, fine. So apart from that, we give DPT. DPT we give at 5 years. 5 to 6 years we will give. Okay, so we give between 5 to 6 years we give DPT, we give DPT booster, and between 10 years 16 years pregnancy, for all these people we give DT. Okay, for all these people we give DT. So this is there in the national immunization schedule, man. This is there in the national immunization schedule. Okay, fine. I don't want to overload a lot, man. First we will see basic things. Okay, fine. So question oriented we will see. Okay, 1 lakh dose. Okay, till 5 years. Okay, fine. This is the national immunization schedule. Okay, fine. Now this is about Mission Indradhanush. The purpose is to launch the what is the purpose of Mission Indradhanush? To increase the vaccine coverage actually. Okay, then they intensified the program. They want to increase it more also. Okay, fine. So we'll go to the next question. You answer this question. Okay, answer this question. Can you answer it? Fine. 'What is the answer? An 18-month-old unimmunized child coming to the hospital for the first time. What are the vaccines to be given? Okay, what are the vaccines to be given? Yes. What are the vaccine? Please answer. 18-month baby, first time. Okay, so what is this concept? Under national immunization schedule, under national immunization schedule, there are some vaccines, okay, we can give only to specific time period only you can give. Okay, fine. So now what are the vaccines we give? Okay, maximum. Now some vaccines not more than 1 year. What are the vaccines not to be given more than 1 year of age? Not to be given more than 1 year of age. So you can see these are the vaccines not to be given more: BCG, Rota, IPV, hepatitis B, Penta, PCV. These are the 6 vaccines you should not give more than 1 year of age, guys. Not more than 1 year of age. Okay, fine. Not more than 5 years. Some vaccines not more than, that is 1 to 5 years you can give, but not more than 5 years. Okay, what are the vaccines not more than 5 years? Not more than 5 years. Okay, not more than 5 years. What comes in not more than 5 years? MR vaccine. MR vaccine you should not give. OPV you should not give. Vitamin A. We are talking about national immunization schedule, not in other pediatric schedule. Okay, IAPS, IAP schedule and all I'm not talking. I'm talking about national immunization schedule. Next. Up to 7 years. Which vaccine you can give up to 7 years? Up to 7 years, you can give DPT. Up to 15 years, you can give JE. JE is not given in every part of India. It's given in specific parts of India where Japanese encephalitis is common. Okay, up to 7 years, up to 15 years. Okay, fine. So am I clear? Now answer this question, man. Okay, answer this question. The 18-month child means first time the child is coming to the hospital. First time the child is coming. Okay, fine. So what are the vaccines we give? What are the vaccines we can't give? Okay, first time it's coming. So first we will see based on this concept. Okay, fine. BCG is there, rejected. So here again BCG, hepatitis B. Okay, IPV. Okay, so answer is D. Don't say that I have taken hepatitis B vaccine and all. Don't say. Okay, DT you can give anytime. Okay, there is no time period for DT. You can give anytime. Any injury, pregnancy, any age you can give. Okay, fine. So don't say that I have taken hepatitis B vaccine. Hepatitis B vaccine is that is not what we are taking, is not part of the immunization schedule. For children it's 0.5 ml, for adult it is 1 ml. Okay, fine, yes. Fine. We'll go to the next question. Which of the following vaccines can result in thrombocytopenia? Which of the following vaccines can result in thrombocytopenia? Okay, fine. What is the answer here, guys? What is the answer? Yes. Fine. So the answer for this question is, this is called as AEFI. AEFI means adverse events following immunization. Adverse events following immunization. Okay. So what is the answer here? What is the answer here? Yes. Okay. So this is thrombocytopenia or ITP, idiopathic thrombocytopenic purpura, is associated with MR vaccine, guys. MR vaccine, measles vaccine. If it is there, this is the associated. Okay, fine. So what other things we should know? Okay, one is OPV. OPV is associated with what? OPV is associated with VAP. What is VAP? VAP means vaccine associated paralytic polio. VAP. Okay, fine. VAP is, that is the OPV which we are giving. That virus gets mutated and it can cause paralysis in the children. That is VAP. Okay. So VAP is which one? It is caused by type 3. It is type 3 VAP. Okay. One more term will be there. VDPVs. Okay. Vaccine derived polio virus. That is type 2. This one is VAP type 3, guys. Type 3. Okay. Fine. So next is DPT can cause certain things. DPT can cause, okay, persistent inconsolable screaming. Okay, persistent inconsolable screaming. The baby will be keep on crying more than 3 hours. Okay, whenever you are vaccinating, baby will be keep on crying. Okay, so that is one. Okay, second, it can cause hypotonic hyporesponsive episodes. Hypotonic hyporesponsive episodes. Okay, hypotonic hyporesponsive episode. COVID vaccine is not part of national immunization schedule, doctor. It's a separate vaccine. It's not part of the national immunization schedule. Okay, fine. Fine. So OPV, DPT. Okay, fine. One time AEFI comes means, okay, the next dose is contraindicated. Understand? If one time AEFI comes means next dose is contraindicated. Contraindicated. Okay, fine. So this is VAP, DPT, MR vaccine. These are common AEFIs. Common AEFIs. Okay, fine. Now we'll go to the next question, guys. We'll go to the next question. Next question. Okay, fine. Yes. Shall I go to the next one? Able to follow? Okay. Answer this question. An auxiliary nurse midwife has to conduct a vaccination camp in a village. She received 2 open vials. Which of the one is pentavalent, other one is MR vaccine? What can she do regarding utilization of these vials? Okay, fine. Able to follow, guys? Okay, the question is related with open vial policy. Answer, you answer. I will write what is open vial policy. Okay, the question is related with open vial policy, guys. Okay, open vial policy. What does it mean? What does it mean? Okay, look here. Okay, normally the vaccine should be used, okay, once opened to be used within how much time? Within 4 hours, guys. Okay, once you opened it, it should be used within 4 hours. 4 hours you have to use it. Okay, so what are the vaccine? Okay, what are the, you can remember like BCG, MR, JE and Rota. These are the 4 vaccines, guys. Okay, these are the 4 vaccines. Once you opened it, according to National Immunization Schedule, these are the 4 vaccines. Okay, these are the 4 vaccines you have to use within 4 hours. Okay, 4 hours once you open. Okay, under open vial policy, remaining all vaccines can be used for 4 weeks. You have to just check the vial. Okay, so when it has opened, it has to be used for 4 weeks. Okay, 4 weeks. 4 weeks. COVID also comes in open vial. This one you have to use within 4 hours. COVID comes in within 4 hours. Okay, since it's not part of national immunization, I'm not touching it now. Okay, fine. So remaining all vaccines can be used within 4 weeks. Up to 4 weeks you can use. 4 weeks. But what you have to do is that you have to put the date, what date it has opened. Okay, that one you have to do it, guys. Okay, that one you have to do it. Okay, fine. Now look at the question and answer. What is the answer for this question based on this concept? What is the answer for this question? So we have this pentavalent. Pentavalent you can use it for 4 weeks. And MR vaccine you have to discard it. Okay, fine. So use pentavalent and discard MR vaccine. Okay. Now the question is, measles vaccine comes in a, it comes in a powdered form. So the measles vaccine, if it is used more than 4 hours, what will happen? Okay, measles vaccine used more than 4 hours. What can happen? It can cause what? TSS. Toxic shock syndrome. It can cause TSS, guys. Toxic shock syndrome. It can cause TSS. Toxic shock syndrome. Okay, so am I clear? Toxic shock syndrome. Okay, fine. Next. So what is the temperature? Cold chain we will see. Okay, cold chain. So ideal temperature is, okay, +2 to +8 degrees Celsius. Fine. Where will you store the vaccines? At a PHC. PHC you have to store vaccines at only in ILR, ice lined refrigerator. Ice lined refrigerator. Okay. ILR. In PHC you store only in ILR, not in other places, guys. Not in other places. Okay, fine. Now deep freezer you should not store, only ILR. Okay, fine. What is the so you have to see what is the most heat sensitive vaccine. Okay, most heat sensitive vaccine is, okay, BCG after reconstitution. BCG comes in powdered form. So BCG after reconstitution is the most heat sensitive vaccine, followed by OPV. Okay, fine. What is the name of the test we can do for this this one to know whether the vaccine is exposed to heat or not? Okay, anyone? Come on. Hello doctors, you can tell. Hello Viraj. Yes. So what is the vaccine most heat sensitive? What is the mechanism we have? What is the mechanism to check whether the vaccine is exposed to heat? Cumulative exposure. Okay. Okay, fine. Yes. You are a future doctor. Excellent. So the most heat sensitive vaccine is not VVP, VVM, vaccine vial monitor. Which stage you can use it, which stage you can discard it, guys. Which stage you can use it, which stage we can discard it. 1 and 2. Okay, 1 and 2 use it. 1 and 2 use it. 3 and 4 discard it. Okay, 1 and 2 use it. 3 and 4 discard. This is for heat sensitive, guys. This is for heat sensitive. Okay, Priyanka, what you are writing is shake test. Shake test to identify the frozen vaccine. Okay, frozen vaccine. Shake test is to identify frozen vaccine, which is the most freeze sensitive vaccine. Okay, freeze sensitive. Okay, freeze sensitive vaccine. Most freeze sensitive vaccine. Okay, fine. Most freeze sensitive is hepatitis B. Okay, pneumococcal, DPT. These and all freeze sensitive. Okay, fine. Okay, you will have this VVM 1 and 2 you can use it, 3 and 4 you can discard it, guys, discard it. Okay, fine. So am I clear? Are you able to follow this, guys? Yes or no? Okay, fine. VVM will have VVM will have 4 stages. It will have, okay, outer dark circle, inner white square will be there. The white square should be lighter than the dark circle. The white square should be light. I'm not having an image, so the white square should be lighter than the dark circle. If it is as dark or more dark, means you have to discard it. 1 and 2 means the white square will be lighter actually out of the dark circle. 3 and 4 means that is as dark or more dark, you can discard it, guys, discard it. Okay, fine. Yes. How many questions? 40 questions. We have 2 days, guys. We have 2 days. We'll cover everything. Don't worry. We'll cover everything. Okay, fine. What is the answer for this question? What is the answer for this question? This is an outbreak of acute encephalitis in the community and the vaccination drive. What is true about this vaccination drive? What is the answer? What is the answer here? Sorry, what is it? Okay, the only encephalitis we are talking about here is, what is the only encephalitis we are talking? Yes, the only encephalitis we are talking is JE, guys. JE is the only encephalitis. Okay, fine. So what are the modes of different, this one we will see. Okay, fine. What are the different modes? First is BC, intradermally. What are the vaccines given intradermally? Intradermally, BCG and IPV, guys. BCG and IPV. Okay, fine. Orally, we are giving OPV 2 drops. Okay, Rota we have 5 drops. Okay, 5 drops. Okay, orally. Subcutaneously, we are giving JE and MR vaccine. JE and MR vaccine. Okay, so IM, what are the vaccines we give? IM. So IM we give Penta. Okay, so Penta we will give. Okay, fine. Penta, DPT, hepatitis B, PCV, all these things we give. IM, guys, IM. Okay, fine. Okay, IM. Okay, we'll give this notes. We'll give. Okay, physics wala, this telegram channel, I think. Okay, we'll give that. Okay, fine. Yes. So is it clear? So this is a outbreak of acute encephalitis. Okay, acute encephalitis. The question which we are talking here is acute encephalitis only JE, guys. We will give, guys. We will give. Okay, orally. Okay, excellent. Okay, excellent. Orally will give OPV, guys. Okay, orally will give. Sorry, not OPV. Vitamin A also. Vitamin A also will give. Okay, vitamin A also will give. Okay, PDF we will give. PDF we will give this one. Okay, fine. So answer, what is the answer for this question? Live and subcutaneous. Live and subcutaneous. Okay, fine. Some strains I will show. Okay, what is the strains we will see? What are the different type of strains we will see? Okay, fine. Yes. Lecture के बाद PDF will be uploaded. ठीक है, fine. Okay, fine. Okay, fine. So this question is over. Shall we go to the next one, guys? Okay, able to follow this? Yes. This chapter we have completed. Shall we go to the next one? Okay, we'll have a little bit of water. The voice is having problem. Okay, fine. Okay, vaccine protocol followed after disaster. What is the vitamin A dosage you want? Okay, so vitamin A dosage less than 1 year, it is 1 lakh international units. Okay, more than 1 year you give 2 lakh international units here. Okay, fine. So 9 months you give 1 lakh. After that you will give 2 lakh international units, guys. 2 lakh international units. Okay, fine. Yes. Next we will go, guys. Okay, fine. Yes. Vaccine protocol after disaster. Okay, what we will do is that we will finish the 11th question. We will come back to this 10th question later on. Okay, fine. Yes. What is the answer for this question, guys? 11th first we will finish. 11th we will finish. 11th we will finish. Okay, fine. 11th. triage is done during disaster management to ensure treatment of casualties done properly. Okay, what is the answer? Okay, what is the answer? The both are same. The last two lines are same actually. Okay, fine. Okay, look here. Right now, it's very sad to see that this disaster. Okay, what's the disaster is happening right now? So we are looking into what? Earthquake in Turkey, guys. Okay, if you look at the news, okay, it's very bad. So what are the things we should learn from that? Okay, first. So answer for this question is C is the answer. Okay, fine. C is the answer. What is first is what is the first step? Okay, right now disaster happened in Turkey, so our prayers are with them. First is you have to search, rescue, and first aid. First aid. Okay, search, rescue, and first aid. Okay, fine. Second, where will you do the triage? Okay, you have to triage. Triage is what is triage? Triage. Okay, triage is classifying individuals, classifying injured injured people based on their chance of survival. Okay, chance of survival. Okay, so not first come first basis, it's based on the chance of survival. So what are the color coding we have? What are the color coding we have? We have red color. Red color means the person is high priority. Okay, high priority. Yellow means medium priority. Okay. Green, what is green? Green means ambulatory. Okay, ambulatory. And black means moribund or dead people. Moribund or dead people. Okay, fine. The question here is where the triage should be done right now. Okay, if you take Turkey, okay, so where the triage should be done? The triage should be done at a hospital or site of disaster. Okay, so where the triage should be done? Hospital or site of disaster. Okay, fine. So hospital, not hospital. Okay, the triage should be done at the site of disaster, guys. Okay, site of disaster. Okay, hospital also will be overcrowded, so it's better we do the triage at the site of disaster. Okay, fine. Next. So not the first come first serve. This one is wrong. Green labels is on priority. No, they are the least priority. There is not 3 color actually, 4 color we have. We have 4 color. So moribund patients receive the lowest. Okay, lowest. Okay, fine. Next. We'll go to the previous question, guys. We'll go to the previous question. We will go. Okay, previous question. Hospital you can't do, man. Neelam, Dr. Neelam. Hospital already will be full with patients. Full of patients. So we can't do it there. Okay, so we should be at the site of disaster. We can divide them and we can send them so that they will get a better care. Okay, we could have done for COVID also. COVID also they could have done. They never did a triage actually. Okay, so what happened in COVID is that those who are having less sick, okay, they occupied the hospital more, and those who really needed ICU care and other places, they were not able to access. That was the problem during COVID time. Okay, fine. So answer to this question, guys. Answer to this question. Vaccine protocol followed after disaster. What is the vaccine protocol? Suppose following this disaster, okay, so what should be done? What should be done means, sorry, no mass vaccination. No mass vaccination. Okay, no mass vaccination. No mass chemoprophylaxis. Strengthen routine immunization. Okay, you strengthen RA, I will write. RA means routine immunization. Strengthen routine immunization. Okay, fourth step is healthcare workers. Vaccinate healthcare workers. Priority should be healthcare workers. Okay, during our COVID time is also we have vaccinated with healthcare workers. Okay, so now think and answer. What is the answer? Okay, no mass vaccination. So our focus should be on safe water and sanitation, guys. Okay, provide safe water and sanitation. Okay, sanitation. Now tell me what is the answer for this question, guys. Can you answer it? What is the answer for this question? Yes. What is the answer for this question? Not everyone, man. Okay, everyone get diphtheria. No way. Okay, everyone get TT. No way. Okay, no. Okay, what is this? This is a past NEET question only. Okay, so we should provide on health worker, and so health workers should get the vaccine, and we should provide safe water and sanitation. Okay, fine. We'll go to the next question, man. We'll go to the next question. This much point is enough. Okay, for disaster, we'll go to the next one. Okay, we are going to start epidemiology. Little bit concept based topic. Okay, fine. Is it okay? Able to follow it, guys? Able to follow? Yes or no? What about others? Nisha is fine. What about others? Okay, we have seen 3 topics: concept of health, immunization, and we have seen disaster, guys. Disaster. We'll go to the 4th topic: epidemiology. Probably we'll have more questions here. Okay, fine. Now, first we'll start with this question. Okay, what is the prevalence of TB, guys? What is the prevalence of TB? Can you tell me what is the formula for prevalence? Prevalence means number of current cases. Okay, you write number of current cases means old and new cases by population multiplied by 100. It is expressed in terms of percentage, guys. Okay, old and new cases, okay, multiplied by 100. Okay, this is number of current cases. Okay, so what is the answer here? Small problem, you expect small problems, maybe, may not be, but let us prepare for that also. Okay, fine. So this will help us to understand the subject also. So old plus new cases. So what is this? 500 plus 100 multiplied by 5000 divided by 5000 multiplied by 100. So answer is 12%. Okay, fine. Now, which study will give you prevalence? Prevalence is given by cross-sectional study, guys. Prevalence is given by cross-sectional study. Okay, which study will give you prevalence? Prevalence is given by cross-sectional study. What is cross-sectional study? Okay, what do you do cross-sectional study? You go to a people. Okay, today you check their blood pressure alone. Okay, that is cross-sectional study. Only one time you measure it and come. That is cross-sectional study. So whatever case of hypertension you are finding, it may be a new case or it may be an old case. Okay, fine. Second. The second one, what does it will tell you? It will tell you magnitude of the health problem. How big the problem? Magnitude of the health problem. Okay, magnitude of the health problem. Okay, this is given by prevalence. Okay, this is given by prevalence. Okay, what is incidence then? What is incidence? Okay, what is incidence? Incidence means number of what? Incidence is what? Incidence means number of new cases, but we will specify in a time period. We will specify number of new cases in a particular time by population at risk multiplied by 1000. 100 also you can say, but usually we express in terms of 1000, guys. Okay, usually we express in terms of 1000. Okay, new cases by population at risk multiplied by 1000. Okay, fine. So incident, which study will give you incidence? Incidence is given by longitudinal study. Longitudinal study means what? Sorry, nearby village you go, check their blood pressure today and every 6 months for next 2 years. So you are having a multiple contact. Okay, cross-section study means only one contact with the participant. Okay, incidence means longitudinal study means more than one contact with the participant. Okay, so where it will give, what it will give, it will tell us natural history of disease. What is the use is that it will give us the natural history of disease, how the disease starts, okay, how it went, okay, all these points it will give you. Okay, fine. So am I clear? This is incidence and this is prevalence, guys. Prevalence. Okay, fine. Next. Answer this question. Incidence of a disease in a population of 30,000 and 300 new cases. What is the answer? Not case control, doctor. Okay, Leo, it's not case control. What we get in longitudinal or in cohort study. Okay, longitudinal cohort study. I didn't mention cohort study. Yeah, okay. So one more is cohort study, guys. Okay, cohort study. We'll see what is cohort study. Two studies you will get. One is longitudinal. Second is cohort study. Cohort study. What is the answer for this question? Fine. This post nasal drip is there. It's not getting better. Okay, I'm sorry about it. What is the answer here? Okay, fine. Number of new cases 300 by 30,000 multiplied by 1000. Usually we express in terms of 1000. So this is 10. This is 10. Fine. 10 per 1000. Okay, fine. So one more formula we will see. What do you mean by secondary attack rate? What is secondary attack rate? Okay, what is secondary attack rate? What do you mean by secondary attack rate? Secondary attack rate is number of new cases. Okay, number of new cases occurring within one incubation period of exposure by total number of susceptibles, not everyone, guys. Total number of susceptibles among exposed multiplied by 100. This is secondary attack rate. What is secondary attack rate? Means number of new cases occurring within one incubation period by total number of susceptibles, not everyone, susceptibles. Okay, so total number of susceptibles among exposed. This is secondary attack rate. What is the secondary attack rate? Suppose in a classroom I am going, okay, suppose I am infected, okay, from me how many of them are going to develop the disease? Okay, this is secondary attack rate. Secondary attack rate is a measure of what? Secondary attack rate is a measure of communicability. How infectious the disease to others. Okay, how infectious. Okay, so how infectious the disease to others. That is secondary attack rate. Okay, fine. Suppose secondary attack rate is 90%. What does it mean? Secondary attack rate is 90% means, okay, so out of 100 people, susceptible people are who are exposed, among them 90 will develop the disease. That is secondary attack rate. Out of 100 exposed people who are susceptible, among them 90 will develop. That is secondary attack rate. Okay, fine. So am I clear? This is about incidence, guys. This is about incidence. Fine. Calculate the secondary attack rate. I already taught you. Tell me what is the answer for the secondary attack rate. You tell me what is it. Okay. Sorry. What is the answer here? Okay. So the couple has 5 children. All are unvaccinated for measles. A child got measles on August 15th, 2015. 2 other children developed. Okay. What comes in numerator? What comes in denominator here, guys? What comes in numerator? What comes in denominator? Okay, fine. So totally 5 children. So among them, one child developed measles. A child developed measles. Okay, so what is the answer here? What is the answer? Okay, so what is the answer here? Okay, one child developed measles. Okay, following exposure to that child, okay, 2 more children developed measles. So numerator is 2, guys. Numerator is 2. Okay, what is the denominator? Remember, the primary case has to be excluded both from numerator as well as from the denominator. Okay, the primary case is already a diseased person. From that case only others are getting the disease. So the primary case we have to exclude both from numerator as well as from the denominator. Okay, fine. So 2 by 4 multiplied by 100, this is 50%. Okay, fine. It's very simple, guys. Very simple. Just remember secondary attack rate. Okay, primary case has to be excluded both from numerator and also from denominator. Secondary attack rate is a measure of what? It is a measure of communicability, how infectious the disease to others. Okay, fine. Yes. We'll see some other formulas. We'll see. One is case fatality rate. Okay, what is case fatality rate? Okay, what is case fatality rate? Okay, fine. What is case fatality rate? Okay, suppose I want to find out what is the case fatality rate of COVID. Okay, number of COVID deaths. number of COVID deaths by, okay, number of COVID deaths by total COVID cases multiplied by 100. So what does this mean? Okay, so out of total cases, there were how many deaths were? That is case fatality rate. So case fatality rate discusses what? It discusses virulence. Okay, virulence or killing power, guys. Okay, virulence or killing power. Okay, it discusses how severe the disease, virulence or killing power of the disease. Can you tell me which condition the case fatality rate is near 100%? Case fatality rate is 100%. Can you tell me which condition? Sorry. Okay, fine. 100%. Which one is having 100%? COVID is not 100%. COVID is hardly 1 to 1.5%. Okay, because the volume of cases were high, that's why deaths were more. Okay, but COVID is not 100%. COVID is 1.5, 1 to 1.5. Yes, not polio, guys. It is the rabies. Rabies is what? Rabies is 100%. If you take yellow fever, which is not there in India, the case fatality rate, as per the book, it is 80%. Meningococcal meningitis 80%. JE 20 to 40%. So the case fatality rate is very high for certain conditions. Okay, the most important one is rabies, guys. It is rabies. Okay, fine. Yes. Okay, we'll go to the next question, guys. Okay. All are true for point source epidemic except. All are true for point source epidemic except. HIV, no. Healthy pill. HIV is no. HIV is still what? Usually case fatality rate is used for acute conditions, not chronic conditions. Chronic conditions is, HIV is a chronic condition. Okay, still who's that? Magic Johnson is still living. He got infected in 90s. Still living Magic Johnson, and he is healthy. Okay, the case fatality rate usually for acute conditions, not for chronic conditions. Okay, fine. What is the answer for this question, guys? Answer for this question. All are point source epidemic except. The question here is all are point source epidemic except. Okay, fine. Yes. So point source epidemic, we'll take a simple example, is food poisoning. Okay, food poisoning. Okay, in your hostel they are making some food, non-vegetarian food. Okay, all of you are eating at the same time. Okay, that is a point source. Okay, after that, okay, so the epidemic curve, how it looks like. Okay, so this is, let us take this is the epidemic curve. So time you take it in the x-axis, number of cases in the y-axis. Okay, fine. So this is where all of you are eating food. After some incubation period, the cases sharply it increases, then sharply it comes down. So what are the characteristic features? Sharp rise and sharp fall. Okay, sharp fall. Sorry. So sharp rise, sharp fall. All cases occur within one incubation period, right? All cases occur within one incubation period. Okay. So there is no, only one peak is there. Only one peak. Okay. There is only one peak. There is no secondary waves. But no secondary waves. No secondary waves means there is no person-to-person transmission. There is no secondary waves. Okay. So this is about, what is this? This is a point source. This is point source epidemic curve. Point source epidemic curve. There is no secondary waves are there. There is no secondary waves. Okay, what is the answer for this question, guys? What is the answer for this question? I think all of you have answered it correctly, mostly. So this is person-to-person transmission. All are right, guys. Epidemic curve, sharply it increases, sharply it comes down. Clustering of cases. Okay, all cases occur within one incubation period. Narrowly it will happen. Okay, so person-to-person transmission is not seen. Okay, where will you see person-to-person transmission? Where will you see it? Okay, there are others are there. Common source, continuous exposure. Sorry. Common source, continuous exposure. Okay, common source, continuous exposure. So common source, continuous exposure, example is contaminated well, guys. Contaminated well. Okay, the well is there, it's got contaminated. Okay, the well is there, it got contaminated with cholera. People are coming and fetching water at different times. Okay, people are coming. Okay, today somebody is fetching water. Tomorrow somebody is fetching water. Day after tomorrow somebody is fetching water. Okay, now can you tell me? Okay, so what is characteristic? Okay, fine. Sharp rise will be there, but gradual fall will be there. Gradual fall will be there. Gradual fall, and one incubation period? No, more than one incubation period. More than one incubation period. Okay, fine. And here also no secondary waves. That means no person to person transmission. No secondary waves. Maybe a cholera infected well. A well is there with water which has been infected with cholera. So people are coming fetching water, different types. Okay, so what will happen? This is common source, continuous exposure, guys. Common shows continuous exposure. Okay, fine. The next is propagated epidemic. So propagated epidemic. So what we are having is propagated epidemic, COVID and all. Gradual rise and gradual fall, guys. Okay, gradual rise and gradual fall. So we have this person to person transmission. We have person to person transmission. We have, okay. So gradual rise and gradual fall, and we have is person to person transmission. Okay, fine. Okay, fine. So is it clear? Okay, everybody is fine with this? Okay, fine. Am I clear? Yes or no? Okay. So what we will do is that some vaccine strains we will tell. Then we will come back here. We will come back to this. Okay, fine. COVID will come there. COVID will come there only. Okay, fine. Okay, you'll have some match the following of vaccine strains. Can you tell me what is the answer here? We have some common vaccine strains. Okay, fine. So malaria, what is the vaccine strains? Okay, not practiced in India. Okay, so what is malaria? Malaria vaccine strain is malaria. What is the vaccine? Some we will spice it up. Okay, little bit. Okay, fine. Malaria, what is the vaccine strain? Malaria, it is RTS1-S. This is malaria. Okay, fine. Can you tell me what is the vaccine strain for dengue? Dengue, it's available in India. For malaria, RTS1, that is for falciparum malaria, which is given in African countries, not here. So dengue, we have this CYD TDV, guys. Okay, CYD TDV. Okay, fine. CYD TDF. Okay, TDV. Okay, fine. JE, what is the vaccine strain? Last year NEET question. Yes, JE, what is the vaccine strain? JE, yes, JE is third one. SA 1414. To this is what we give in the program. It's a live vaccine. We give it in the program. It's a live vaccine. Yellow fever, what is the answer? Yellow fever. Yellow fever, last year NEET question. Yellow fever is 17D vaccine. 17D. It's also live vaccine. Yellow fever. Typhoid, we have this typhoral vaccine. Typhoid, we have this typhoral vaccine. TY21A. Okay, fine. Next is cholera. We have this Dukoral vaccine. Cholera, we have Dukoral, Sandcal. Okay, so all these vaccines are available. Uvicol. Okay, fine. And mumps, what is the strain we have? Mumps, we have what we have. Mumps is what? Geraldine strain. Mumps we have is Geraldine strain. Mumps. Okay, fine. What is the measles strain? Nakayama, we don't use it. Dr. Neelam, Nakayama, we don't use it. Nakayama, we don't use it. What we use is SA 1414-2. Okay, fine. And this one, rubella, measles, it is Edmonston Zagreb strain. Measles, we have Edmonston Zagreb strain. Mumps, we have this. Geraldine, we have completed. Rubella, it is RA 27/3. TB, it is Danish 1331 strain. Okay, Danish 1331 strain. Is it fine? Okay, Danish 1331 strain. Able to follow this? Yes or no, guys? Yes or no? Okay, fine. If you are interested, I can show you other things we will see later on. Okay, we'll go back there. We'll go back there. Okay, fine. So, fine. Is it fine? Yep. Okay, false about case control cohort study. Okay, so the topic we are going to discuss is pace is okay, able to follow this. Okay, nobody is asking me to talk in Hindi. That is also fine. Okay, fine. Hindi ठीक है, बात कर सकता है. Fine. So this is case control and cohort study. Case control and cohort study. Okay, what is case control? Okay, what is case control study? These are analytical type of study. Starts from exposure to analytical study. It starts from where to where? Outcome to exposure, guys. Okay, outcome to exposure. Case control. So it goes from outcome to exposure. Okay, fine. So that is why it's what study? Retrospective study. Other name is case reference study. Other name is case reference study. All are names of this case control study. So this is the population. Okay, this is the population. Okay, so Hindi. Okay, I will try, man. Okay, I'm not that good. Okay, कोशिश करूँगा, ठीक है. So this is people from the population. You take exposed people. Sorry, you take cases. Okay, so you take cases and control. So if our example is smoking and lung cancer, from the population you select people with lung cancer, people without lung cancer. Among them, some will be exposed, some will be not exposed. So here also you take it exposed and not exposed. Okay, fine. So this is a case control study. Okay, starts from outcome to exposure. Okay, so smoking and lung cancer will start with people with lung cancer cases and controls, and people controls. Who is a case? Case means people with disease. People with disease. Who is a control? Control means people without disease. So people with disease, they are called as cases. People without disease, they are called as controls. Okay, fine. Okay, controls. Okay, fine. Now, next. Okay, no problem. No problem. We can talk all languages. Okay, fine. Now, so we will what we can see. Okay, what we can see in a case control study. So it's going backwards. So it takes less time, less cost. Okay, it's we can do it little easier actually. Okay, fine. Now, what is the thing we can find here is in a case control study, we can find what is the result. Results is based on odds ratio. What is the other name for odds ratio? What is the other name for odds ratio? Other name for odds ratio. Other name for odds ratio. Few years back in NEET is asked. So the other name for odds ratio is cross product ratio. Cross product ratio. So odds ratio indicates what? Odds ratio indicates strength of association. It measures strength between exposure and the outcome. Okay, fine. So odds ratio equal to 1 means what? Odds ratio equal to 1 means no association. Odds ratio more than 1 means positive association. Odds ratio less than 1 means negative association. Negative association. Okay, fine. So equal to 1, no association. More than 1 means positive association. Less than 1 means negative association. Negative association. Okay, fine. So smokers odds ratio, smoking and lung cancer comes as 5. What does that mean? Okay, smoking and lung cancer comes as 5. What does it mean? Okay, in simple terms, you can say that. Other way also you can say, okay, people with lung cancer are 5 times more likely to be exposed to smoking when compared to people not having lung cancer. So smoking and lung cancer, it comes 5 means. Okay, so people who are having lung cancer are 5 times more likely to be exposed to smoking. So more than 1, what does it indicate? More than 1 is the risk factor, guys. More than 1 is a risk factor. Okay, so less than 1 is protective factor. Suppose odds ratio comes as 5. Okay, protective factor. So odds ratio comes as 5. 0.5. 0.5 between physical activity and cardiovascular disease. Odds ratio comes as 0.5. What does it mean? What does it mean? People who are doing exercise, they are half the chance of developing CHD. People who are doing exercise. So physical activity and cardiovascular disease. So people with exercise, they are having 0.5 times. Okay, 0.5 means half the chance of developing. So less than 1 means it's a protective factor. More than 1 means it's a risk factor. Am I clear? Equal to 1 means no association. Okay, fine. Yes. So now we'll go back to the question. What is the answer here? Cohort study. Okay, we'll see the cohort study also. We'll see. So cohort study. Okay, cohort study. It starts from exposure to outcome. Okay, it starts from exposure to outcome. Okay, we'll take this example. Population. From the population you select exposed, non-exposed. You follow them over a period of time. Some will develop disease, no disease. Okay, these people you follow them. Okay, disease, no disease. Okay, so this is cohort study. What is the problem in cohort study? It takes lot of time, man. It takes lot of time. You have to follow people who are exposed. Let us take our example: smoking and lung cancer. Lung cancer people with smokers and non-smokers. You have to follow them for 10 years, 20 years. What will happen? What will happen? Okay, you have to follow them over a long period of time. You have to follow them over a long period of time. So people, it's practically very difficult. Okay, very difficult. So that is why it's called as prospective study. Cohort study, we call it as prospective, because from today onwards we are going. Okay, so case control study, we go back in time. We go back in time and try to find out how many of them are having exposed. That's why it's called as retrospective study. So which one takes more time, case control or cohort study? So as you can see that cohort study takes more time. Okay, fine. हिंदी में समझाओ. Okay, try करता हूँ. Okay, fine. So case control study, you go back in time. Okay, and cohort study, you prospectively you go. Okay, fine. Now what is the point here? What is the point? The problem with the case control study, two comparison we will see. Okay, so less time, more time we have seen. The main problem with the case control study is recall bias. Okay, you are going to ask something that has happened way long back in a case control study. Okay, do you think people will remember? Okay, we don't remember what we studied yesterday. Am I clear? Do you remember what you ate last week? We don't remember unless you studied with your you ate with your dinner some girlfriend. Okay, something like that. We don't remember. Okay, so unless otherwise in a hostel. Okay, today is what? Today is Tuesday. Okay, so do you remember what you ate on last Tuesday? Unless you are in a hostel, guys. Unless you are in a hostel, we don't remember. Okay, fine. So you are asking something about their exposure. It has happened. Okay, so you are asking them regarding when you got exposed. Okay, when you got exposed. So people may not remember. Okay, so that's a problem. Cohort study, the main problem is you ate biryani. Yeah, excellent. Okay, fine. So cohort study main problem. What is the main problem in cohort study? Loss of follow-up. Okay, loss of follow-up. Okay, fine. Also called as attrition. Let us see for this class. I don't know how many of you are watching. Okay, over a period of time, what will happen? People will try to go away. That is called as loss of follow-up. Also called as attrition. Okay, fine. So recall bias case control study is more useful for rare diseases. This one is rare exposure. Okay, rare exposure, go for cohort study. Rare diseases, go for case control study. Rare. Okay, fine. So am I clear? Yes. Fine. Now we'll go back to the question, guys. You answer this question. We'll go statement wise. Case control study must be used for rare diseases. That is true. Cohort study is generally prospective in direction. That is also true. Cohort choose based on the exposure. Yes, it starts from exposure to outcome. Case control study requires more time than cohort study. That is false. The question is false. False. Okay, fine. We'll go to the next question, guys. Next question. Okay, fine. Take it. Just focus here, guys. Just focus. Okay. So whatever I can do, that I will try. Okay, fine. Fine. What is the answer for this question, guys? Okay, I'll read the question. Okay, just focus here. Okay, Hindi में बात करने के लिए कोशिश करता हूँ. Okay, I'm not that well versed. I'm repeating again. I studied in Gujarat. Okay, PG, but I'm not that well versed. Okay, I'll try. Okay, fine. Yes. So researcher want to know whether there is an association of CRP values with risk of MI and stroke. The study group was divided into quintiles and following tables are formed. Which of the following statement is true? That's what they are asking. Okay, fine. Now look here. We have to see the analysis of cohort study. In analysis of cohort study, what are the things we can find? First, we can find this incidence we can find. Okay, incidence we can find. Second, one is you can find incidence. Second, you can find relative risk. Incidence among exposed, incidence among non-exposed. You can find relative risk, you can find, guys. Relative risk you can find. Okay, fine. So what is relative risk? Relative risk is similar to odds ratio. It indicates strength of association, guys. Okay, it indicates strength of association. Relative risk is similar to odds ratio. It indicates strength of association. Equal to 1 means what? Equal to 1 means no association. Okay, more than 1 means positive association. Less than 1 means negative. Same interpretation. Okay, fine. Relative risk, okay, equal to 1, no association. Okay, more than 1 means positive association. Less than 1 means negative association. This is relative risk. It is similar to that of odds ratio. Third one, what you can find is attributable risk. Okay, what is attributable risk? Okay, it comes in percentage. Okay, it is the difference between, I will write in short form. Okay, incidence among exposed minus incidence among non-exposed by incidence among exposed multiplied by 100. Comes in percentage. I will write in short form. Incidence among exposed minus incidence among non-exposed by incidence among exposed multiplied by 100. It comes in percentage. That means how much percentage of disease is attributed to the exposure. It comes as 90%. What do you mean by that? Okay, 90% between smoking and lung cancer. What does it mean? So 90% of lung cancer among smokers are due to smoking. Among smokers. Okay, how much percentage of disease is attributed to the exposure among exposed, not everyone. Okay, not the general population. Okay, how much percentage of disease is attributed to the exposure among exposed. Okay, fine. So that means for 10% some other cause is there. These are the three important things you can find: incidence, relative risk and attributable risk. Okay, fine. Now tell me what is the answer here. Now answer this question, guys. Tell me what is the answer for this question. Yes. Okay, fine. Yes. So if you look here, excellent. Okay, most of people are putting B. Okay, that's good. As the CRP value, C-reactive protein values are increasing, the relative risk is also increasing. Okay, so there is a linear trend. Is that if one value is increasing, the other values increases. Okay, so what is the answer here? Yes, increase in CRP. Okay, increases the risk of MI and stroke. Increase in CRP values increase the risk of MI and stroke. Okay, fine. Able to follow this, guys? Yes or no? Increase in CRP values increase the risk of MI and stroke. Okay, fine. Okay, what about others? Are you able to follow this, guys? Please let me know. Already I am seeing some form of attrition. People are escaping from chat. Okay, fine. Yes. Bias, you want me to go fast? Okay, fine. Able to follow? Okay, fine. Yes. Okay, fine. So what is bias means what? Bias means whenever we are doing research, is there any systematic error, guys? Any systematic error. So whenever we are doing research, okay, any systematic error we do, that is called as bias. Okay, so one type of bias is there is, so Berkesonian bias. We have selection bias. If the error happens during selection, it is selection bias. Okay, fine. If this error happens during collection of information, this is information bias. We have two types of bias overall. So many are there. We'll stick on to the NEET exam. Okay, so if error happens during selection, it's called as selection bias. If error happens during collection of information, then we call it as information bias. Okay, fine. So selection bias means the people who are, we'll take case control study. Okay, the people who are selected, people who are not selected, there is a difference is there. Okay, so that is selection bias. For example, the answer for this question is Berkesonian bias. Okay, fine. I want to do a study on diabetic people, guys. Okay, I want to do a study on diabetic people. Okay, so Berkesonian bias happens because of selecting people only from the hospital. Okay, fine. Let us take this example. Okay, let us take this example. So bias, people of diabetics who are there in the hospital and the diabetics in the community, are they same or different? Okay, people with diabetes in the hospital and people with diabetes in the community, are they same or different? They are not same. Okay, who is going to be there in the hospital? People with severe conditions. Okay, people with multiple diseases, they are going to be there in the hospital. Okay, so ideally I should select both set of people in hospital also, people in the community also. But if I am selecting only the people only in the hospital, this bias can happen. Okay, fine. This is selection bias, guys. This is selection bias. Second is information bias. What is information bias? So there is a error is there during collection of information. Okay, for example, recall bias is an example for information bias. Okay, so whatever information they are giving, that may be error. Okay, because of my recall, so what can happen? So a exposed person may say I am non-exposed. So what can happen? So you are classifying the exposed person as non-exposed. That we call it as information bias, recall bias. Berkesonian bias is what type of bias? Is an example for selection bias. Selection bias. Fine. Next we will see one more condition called as what is confounding factor. Okay, what is confounding factor? What is confounding factor? Confounding, what do you mean by confounding factor? There was one study was there in 80s. This study claimed that if you drink coffee, if you develop pancreatic cancer. Do you accept this finding? This was the result of the study. Okay, so coffee drinking associated with pancreatic cancer. So do you accept this finding? No, we don't accept. We love coffee. So, but this result came because of a confounding factor. Yes. So, to call it as a confounding factor, it has to be associated with both exposure and outcome. Okay, to call it as a confounding factor, it has to be associated with both exposure as well as outcome. Second, it should be an independent risk factor. It should be an independent risk factor. Okay, it should be an independent risk factor. Okay, third, it has to be distributed unequally between study and control groups. It has to be distributed unequally between study and control groups. Okay, so it has to be distributed unequally between study and control groups. Okay, equally if it is distributed, it's not a problem. It has to be distributed unequally. Okay, so what can be the confounding factor between coffee and pancreatic cancer? Okay, what can act as a confounding factor? Yes, between what is associated with coffee as well as pancreatic cancer, usual students' answer will be what? Alcohol. Okay, fine. Okay, alcohol. Okay, we don't mix it. Okay, maybe there some coffee is there. Okay, where they will mix a coffee, alcohol, but that is not the confounding factor. It's smoking. Okay, people who drink coffee, they smoke. Not everyone. And smoking is an independent risk factor for pancreatic cancer. Okay, this was asked actually. What is a confounding factor? Probably I think 1 or 2 years back, the statement was asked. Okay, so confounding factor as a statement was asked. You have to understand it, guys. Okay, understand. It has to be associated with both exposure and outcome, and it has to be distributed unequally between study and control groups. Okay, fine. Yes. What is the answer for this question? Okay, we have seen confounding factors. We'll go to the next question, guys. We'll go to the next question. What is the major purpose of random assignment? What is the major purpose of random assignment? Okay, fine. What is the major purpose of random assignment? Is the major purpose of random assignment is what? Okay, the major purpose of random assignment is clinical trial. First, we will see. So, confounding factor again. Okay, to call it as a confounding factor, it has to fulfill 3 criteria, guys. One, it has to be associated with exposure as well as outcome. So, smoking is associated with coffee drinking as well as with pancreatic cancer. Okay, fine. So, it should be an independent risk factor. That means without coffee, smoking can cause pancreatic cancer. Second, third, it has to be distributed unequally, not equally, unequally between study and control groups. Equally means not a problem, unequally. Okay, fine. So, hope Dr. BGS this clears your question. So, the major purpose of random assignment. Okay, fine. Clinical trial. First question. Okay, clinical trial. Okay, RCT is which phase? RCT is phase 3. Phase 3. After RCT, the drug will come into market, guys. After RCT, the drug will come into market. So, it will come into market, it will come. After RCT, it will come into the market. After coming into market, the fourth phase will start. The fourth phase is post-marketing surveillance. So, where they will look for long-term side effects. Okay, fine. Now, RCT. What is RCT? Look here. So, I have a new drug for hypertension, guys. Okay, I have a new drug for hypertension. I want to check whether my new drug is better than the existing drug. I want to check whether my new drug is better than existing drug. Okay, so what I will do, I will take a sample. Okay, so I have a new drug for hypertension. I will take a sample. From this, I will do a technique called as randomization. Okay, randomization. I will do randomization. So, I am going to divide them into 2 groups using randomization. Group A, I am going to give drug A. For other group, I am going to give drug B. After some time, I am going to just compare the outcome. I am going to compare the outcome after some time. So, after some time, okay, I just followed up. After some time, I am going to compare it. Okay, compare it. Sample, randomization, and you are going to give the drug. So, what is the use of randomization? Randomization, what is randomization? Suppose हमारा पास 100 people है, okay, 100 people are there. So, I want to divide them into 2 group, okay, 2 groups I want to divide them, okay. So, what I will do is that, so I will put them in a lot, okay. So, पहला वाला group A, first person is group A, okay, दूसरा वाला group B, okay, like that I can go. This is randomization, okay. So, it eliminates what? Randomization, most important point is that it eliminates selection bias. Okay, it eliminates selection bias. Second, it ensures comparability. It ensures comparability between the 2 groups. Okay, it eliminates selection bias and it ensures comparability between the 2 groups. Okay, fine. So, am I clear? It eliminates selection bias and it ensures comparability between the groups. Okay, fine. So, then we do this RCT. So, RCT is phase 3, guys. RCT is phase 3. So, even in RCT, some amount of bias will happen. So, patient can create bias, the doctor can create bias. So, the analyzer can create bias. So, to reduce that, we use a technique called as what? What is the technique we use to reduce bias in RCT? Yes, blinding. Okay, blinding. We use blinding. So, what comes in blinding? Okay, what comes in blinding? We have different trials are there. Single blind trial. Single blind trial means patient doesn't know he is on which treatment, whether he is on treatment A or treatment B, that he doesn't know. That is single blind trial. Double blind trial. What is double blind trial? Double blind trial means patient also doesn't know and doctor also doesn't know. Okay, even doctor can create bias. Okay, fine. So they both doesn't know who's the treatment group, who's the control group. Third one is triple blinding. Okay, triple blinding. What is triple blind trial? Triple blind trial means so what is the triple blind trial? Triple blind trial means doctor, patient and analyzer, who's both, all three will not know who's the treatment group, who's the control group. Maybe a fourth person will be there. He will make sure that all collect the data. Finally, he will do the analysis. Okay, fine. After analyzing, he will do the final work. So ideal is, which one is the ideal one? Which is the ideal one? Triple blind is the ideal one, but practically very difficult. So double blinding is the most commonly used. Most commonly used. So ideal is triple blinding, but practical difficulties are even double blinding also very difficult. Okay, good medical colleges, good system they do, but practical difficulties are there. Okay, so double blinding is the most commonly done. Okay, fine. So am I clear, everyone? So what is the answer for this question? The major purpose of random assignment a clinical trial is for what? Yes, study subjects, okay, are comparable at the baseline characteristics. Sorry, study groups are comparable on baseline characteristics. Okay, fine. Are you able to follow this, guys? Yes or no? Yes. Are you people following? Okay, facilitate double blinding. Yes. Fine. All others are wrong, guys. Okay, just give me the feedback. Are we able to follow this? Okay, excellent. Okay, this 20th question we will stop. Okay, epidemiology will finish. Okay, we'll try to finish epidemiology, guys. Okay, we'll try to finish epidemiology. 3 more questions are there. Then we will take a break. 10-15 minutes break we will have. Okay, fine. Sorry, this post-nasal drip is there, guys. Okay, that's why I'm coughing. Okay, fine. So the transmission of malaria is an example of, okay, transmission of malaria is an example of what? Transmission of malaria is an example of what? This is infectious disease epidemiology. So what happens when the agent enters into the vector? So propagative means, okay, when the agent enters into the vector, okay, agent enters into the vector, only what will happen? Multiplication will happen. Okay, multiplication happen, guys. Okay, only multiplication happen. That is propagative transmission. Only multiplication happens. Only multiplication. Okay, so you can remember P for P, plague. Okay, when the agent enters into the vector, both multiplication and what will happen? So you will have both multiplication and development will happen. Okay, both multiplication and development will happen. So then it is cyclopropagative. Example is, answer is malaria, guys. Example CPM. Like you can remember like CPM tablet, guys. Okay, malaria. Example is malaria. Cyclodevelopmental means when the agent enters into the vector, only development happens. Okay, so agent enters into the vector, only development happens. Example is filariasis. Okay, fine. This is propagative, cyclopropagative, cyclodevelopmental. Okay, only development happens. Okay, only development. That's why this filariasis never occurs in outbreaks. Okay, some other terminology in infectious disease epidemiology we can see. What is endemic means what? What is endemic? Endemic means constant presence of a disease, guys. Presence of a disease in any given area, constant presence of a disease. For our country and all, most of the diseases are endemic. Okay, so so our country is so big that we have most of the diseases except very few. Yellow fever, hemorrhagic fevers are not here. Okay, fine, not that much. Then we have what is epidemic. What is epidemic? So unusual. Okay, unusual increase, okay, in number of cases. Okay, unusual increase in number of cases in excess of expected frequency. Okay, so unusual increase in number of cases in excess. So compared to this excess expected frequency, there is unusual increase is there. Then it becomes epidemic, guys. Okay, epidemics. What is pandemic? What is pandemic? Pandemic means, okay, 2 or more WHO regions are affected. 2 or more WHO regions are affected means pandemic. Okay, so we have this pandemic we have. So what is the Asia is there, we have Africa, we have Europe. So WHO regions are there. Okay, so WHO regions. What is the current pandemic? Current pandemic everybody should know, it's COVID-19. What is the previous pandemic? Okay, that was asked in 2020 NEET question. So what is the previous pandemic? Previous pandemic is H1N1 guys, H1N1. Okay, we have in 2008-9. Okay, fine. So am I clear? So these are the points we should know guys. These are the points we should know regarding this some changes terminologies. Fine, next. Okay, infectious disease epidemiology. What is this time period? The time taken for, currently we are having monkeypox. Monkeypox is not pandemic guys. Monkeypox is not pandemic. Monkeypox is a public health emergency of international concern. That is not pandemic. Okay, so the pandemic what we have is only COVID. Previously we have influenza, H1N1 influenza. Okay, fine. So time taken for 50% of cases to develop following exposure to disease. Okay, you tell me. So we'll see one by one. First is incubation period. You know. Okay, so onset of entry to onset of signs and symptoms. Okay, so agent is entering today into me. After how many days symptoms started appearing? That we call it as what? That we call it as what? Incubation period. Okay, fine. So what is a primary case? Primary case is first case in the community. Suppose there is outbreak is there in a village. What is primary case? First case in the community. Okay, first case in the community. What is an index case? The index case is first case to the health provider. Okay, health provider, index case. So I am a PHC medical officer. So the case that is come to me, that is called as index case. That may be a primary case also. If the first case is directly came to me means, so that's a primary case. Otherwise, okay, so third case or fourth case is coming. So I came to know there is outbreak of cholera in the village. That is index case. What is generation time? What is generation time? Generation time is what is cyclopropagation? A cyclopropagative, Grim Reaper, cyclic propagation. I can't understand the term. What is cyclic propagation means what? Propagative cycle you are talking about? Okay, generation time means suppose the organism is entering into me. So after how many days I will be maximum infect you guys? Okay, maximum infect you. After how many days I will be maximum infect you to others? So that is called as generation time. Okay, the agent entering into me, after how many days I will be maximum infective. So the median incubation period, this is the answer for this question. So this is during outbreak guys, outbreak or epidemic. Okay, when the agent is entering into the village. Okay, so from that time to 50% of cases to happen. Okay, during epidemic or outbreak. Okay, to 50% of the cases, 50% of cases to happen. Okay, fine. So how fast this is achieving the peak, then it started coming down. So this we call it as median incubation period. Okay, fine. So am I clear? This we call it as median incubation period. Okay, we'll go to the next question. Okay, so after this question we will take a break. Healthy carriers is not seen in. Healthy carrier is not seen in. So carrier means you know that. So they are having this organism. They are not going to show any signs or symptoms. Healthy carrier you can remember like the subject guys. You can remember like the subject. PSMCD. Okay, apparently they will be healthy. They will be transmitting disease to others. So PSMCD. So this is polio, salmonella. Okay, salmonella. MM I am writing meningococcal meningitis, cholera, and diphtheria. Okay, polio. Okay, measles is measles, MU for mumps. Measles is measles. MU for mumps. Diphtheria. Okay, fine. Is it not coming? Influenza. Okay. Polio. Okay. Hepatitis B. And pertussis, guys. And pertussis. Okay, fine. So this is incubatory carriers. This is incubatory carriers. Okay, this is incubatory carriers. They will be transmitting disease during incubation period itself. They will be transmitting disease during incubation period itself. Okay, fine. So am I clear? Yes or no, guys? Yes or no? Are you able to follow this? Yes or no? Shall we go for a break? Shall we go for a break? Yes, yes. Answer, we'll see the answer first, then we'll go for a break. Healthy carrier is not seen in what? Yes, answer this, then we'll go for a break. Okay, fine. You don't want to go for a break, huh? So we will have something. I need some energy at least. Yes. So healthy carrier is not seen in what? What is the answer? Okay, what is the answer here? Okay, it is not pertussis, guys. It is not pertussis. Okay, it is not pertussis. Okay, pertussis. Okay, fine. So what we will do here is, all others are right. Or what we will do, typhoid is salmonella, guys. Typhoid is salmonella. Okay, we'll take a 10 minutes break. Is it fine? So time is 8:32. Can we do it at 8:45? Okay, I will finish by 10:30. Don't worry, I will finish by 10:30. 10:30 I will finish. Okay, fine. Okay, no problem, man. No problem. Just we'll do it. Okay, we'll do it at 8:45, guys. 8:45. We'll try to finish by 10:30. Okay, is that okay? Fine. Thank you. We'll see at 8. I'm repeating again. We'll start at 8:45. 8:45 p.m. We'll do it 8:45 p.m. Okay. Incubatory carrier means during incubation period itself they will be transmitting, guys. Okay. You'll ask me the question again. I will repeat. Okay, fine. Just come back. Okay. Don't attrition. Don't tell me that loss of follow up. Okay. Just come back. Okay, fine. Don't escape. Okay, fine. Okay, shall we start? Yes or no, guys? Shall we start? Am I audible? Yes or no? Am I audible? Shall we start? Okay, fine. So I think it's audible now. So one of you asked previous question. Huh? The question they asked is healthy carrier. So content whatever we are discussing. Okay, so to the recent edition of PARC. Okay, so what is healthy carrier? Healthy carrier, apparently they will be healthy, but they will be transmitting disease to others. That is healthy carrier. What is incubatory carrier? What is incubatory carriers? That means they will be transmitting disease during the incubation period. Sorry, they will be transmitting disease during the incubation period. Okay. So for example, you take measles. The incubation period is 10 to 14 days. So measles will be transmitted 4 days before the rash and 4 days after the rash. So that is the gap, 10 to 14 days. So that time itself they will be transmitting disease to others. So this is incubatory carriers. Okay. During incubation period itself they will be transmitting disease to others. Incubatory carriers. Okay, fine. So we have finished 4 topics. We have finished. Okay. So we will go to environment topic. We will see environment topics. So okay, fine. Yes. So what is the answer here? Open well is lined up to. Answer here is open well is lined up to. What is the answer? This is the question that is related with what is sanitary well. Okay, this is the question related with sanitary well. What does sanitary well? What does sanitary well? Sanitary well, to call it as sanitary well, it should be located, okay, 15 meters or 50 feet, okay, from sources of contamination. Okay, it should be located 15 meters or 50 feet from sources of contamination. Okay, fine. Second, it should be located within 100 meters of houses. 100 meters of houses. Okay, it should be located within 100 meters of houses. It should be located. Okay, on the inner side of the well, hopefully you have seen a well where the inside surface of the well, so there will be a cement or brick lining will be there. Cement or brick lining. This should be there for 6 meters, so that the well will not collapse That is the one advantage. Second is that we want water to come from below, not from sideways, not from sideways. Otherwise, sewage water will seep and slowly it will come into the well. So that purpose, okay, they have a cement lining or brick line inside the surface of the well, inside, so that we wanted to water to come from above. So answer for this question is 6 meters, guys. Answer for this question is 6 meters. Okay, fine. Since we are in water, we will see some other points related with water purification. In rural areas, we use slow sand filters. We use slow sand filters. Okay, slow sand filters. So what are the key points we should know regarding slow sand filters? A slow sand filter, what are the key points? Key points, okay. So slow sand filter, it requires large space. It requires large space is required, okay. So large space is required. Even if you have unskilled workers, it is fine. Unskilled workers, okay, with that we can manage it. Unskilled workers also we can manage it. This is slow sand filters, large space, unskilled workers are there, is fine. And in the slow sand filters, it filters slowly, as the name suggests. It forms an important layer called as biological layer or layer of Schmutzdecke. This is the layer, okay. This will be there at the top layers of the sand bed, okay, fine. We can't go deep, we don't have time. So on the top of the sand bed, this layer will be there. This is the layer that purifies water, okay, fine. And there is an instrument will be there within that sand bed. So we call it as slow sand filter, which is called as venturimeter. This venturimeter measures, what is the purpose? It measures sand bed resistance. It measures sand bed resistance, it will measure. Sorry. So this is large space, unskilled workers. And how cleaning is done? Cleaning is done by backwashing. Cleaning is by manually scraping. Okay, this is slow sand filter. We do scraping manually. You have to remove all those cloggings. Okay, all those impurities we have to manually do it. Second is rapid sand filters we use in urban area. Rapid sand filters, urban area, we use it in urban area. It requires less space compared to slow sand. It requires less space, but it requires skilled workers. Okay, it requires skilled workers. Cleaning is done by backwashing. Change the direction of water. So how you are going to do the cleaning? Cleaning is by backwashing, changing the direction of water. You change the direction of water. That's how cleaning is done, okay. And it filters water rapidly. Okay. So, but water, whatever source of water, here we do chemical pre-treatment. Okay, chemical pre-treatment we do. Okay, so chemical pre-treatment we do. Okay, so this is rapid sand water. Now, whether it is slow sand or rapid sand filter, after the stage what happens is that it goes for disinfection. Before coming to us, it should go for disinfection. How disinfection is done? Disinfection is done by one method. Commonly used method is chlorination. We do chlorination. Disinfection is done by chlorination, guys. Okay, disinfection is done by chlorination. Okay, fine. Answer this question, guys. The minimum recommended dose of free residual chlorine in water for routine chlorination is what? Okay, so answer this question, guys. Answer this question. The minimum recommended dose. Okay, fine. All are liter actually. Yes, fine. What is the answer for this question? Answer. Okay, so that means how much chlorine should be there. Okay, first water. What are the points? The main action of chlorination because of hypochlorous acid. Okay, the main action is because of hypochlorous acid. Okay, fine. First we have to find the chlorine demand. chlorine demand. What is the instrument that measures chlorine demand? It is Horex apparatus. So the instrument that measures chlorine demand is Horex apparatus. Okay, Horex apparatus that measures chlorine demand of the water. Okay, fine. Next. So once you found out the chlorine demand, okay, you have to add chlorine. Chlorine usually you add by bleaching powder. So minimum contact period. The contact period, once you added bleaching powder, the minimum contact period should be 60 minutes, guys. Okay, you have to add for 60 minutes. Okay, fine. But when the water is coming out, there should be minimum residual chlorine should be there. How much minimum residual chlorine should be there? Okay, sorry. The minimum residual chlorine should be 0.5 milligram per liter, guys. Okay, that means on the way there is some contamination happens. So the minimum residual chlorine should be 0.5 milligram per liter. Okay, so these are the points we should know regarding drinking water. It is 0.5 milligram per liter. What about swimming pool? Can anyone tell me how much chlorine should be there in swimming pool? Swimming pool, how much chlorine should be there? Swimming pool, yes. Swimming pool, there should be 1 milligram per liter, guys. Swimming pool, it should be 1 milligram per liter. We require 1 milligram per liter swimming pool. Okay, fine. So am I clear? So these are the points we should know regarding chlorination, guys. These are the points. So for drinking water, how will you know the water is chlorinated or not? You want to test whether the water is chlorinated. So what is the test available? The test available is, okay. So the test, what is the test available? The test available is orthotoluidine test. Orthotoluidine test. And one more test is there, orthotoluidine arsenate test. Orthotoluidine test and orthotoluidine arsenate test. Okay, fine. So these are the tests available, guys. These are the tests available for chlorination. These are the tests available to check whether the water is chlorinated or not. Okay, fine. So am I clear? It will identify both free and combined chlorine. So what will happen is, once chlorine is there, once you put this water, okay, and if chlorine is there, it will change into yellow color, guys. Yellow color. Okay, fine. It will identify both free as well as combined chlorination, combined chlorines. Next question. In a controlled tipping, the amount of land required for trench method to be practiced for population of 10,000. Okay, so I feel that this question is like more of a sadistic question. It's there in PARK, guys. Okay, it's there in PARK. So we have this major textbook is PARK. Okay, so if you see PARK, so it will cover all the topics. Okay, NEET exam, they will cover all the topics they will cover. Okay, so that is why I'm not showing any importance to a particular topic. We are trying to cover as much as topic as possible. So in a controlled tipping, the amount of land, so this what they are talking is, this they are talking in terms of solid waste management. Solid waste management. So what comes in solid waste management? Solid waste is solid waste. So what is solid waste? Solid waste. So look here. So solid waste, what are the various methods are available? Solid waste. Suppose any solid waste, that is solid waste. How you are going to dispose it? The first method what we will do is dumping, guys. Dumping. We will identify a nearby place near our house. So we will start dumping all the solid waste. This is dumping. Okay, second is what we can do is called as controlled tipping. Okay, what we can do is controlled tipping. Third is incineration. You can burn it, guys. You can burn it. Fourth is deep burial. Deep burial. Fifth is what? Fifth is we have is composting. Composting. Okay, fifth is composting. So dumping, control tipping, incineration, deep burial and composting. So which is the most insanitary method? Okay, what we are doing is the most insanitary method. This is the most insanitary method. Okay, insanitary method. Control tipping, we have control tipping. It has three methods are there. Further methods are there. Trench, area and ramp method. Okay, trench method, area method and ramp method. Okay, fine. So the question is related with what? Okay, trench method. Okay, so they will create a trench and they want to dispose the solid waste. So how much it will require? So the answer for this question is, for 10,000 population, the question should be for 1 year also. They should mention 1 year, 1 acre of land is required, guys. Okay, 1 acre of land is required. The 1 acre of land is required for this population. This is the most insanitary method, is dumping. Recently asked question. Okay, you answer it. You are going for a trip, okay, somewhere, okay, camping you are doing. Some amount of solid waste is generated. What will you do? Some amount of solid waste is generated. What will you do? Okay, don't tell me that I will dump it and come. Okay, so if you want to do sanitary method, it should be deep burial. So deep burial is used for camping purpose, for camping. Okay, for camping we can do deep burial, we can do camping. This NEET question. Okay, fine. But they asked first time, for me also I was searching in the book. Okay, more sadistic question, guys. Okay, fine. We'll go to the next question. Mean radiant temperature is measured by. Okay, so we have this. It's measured by, answer is globe thermometer. So we have various things we should know. One is we have this Carter's thermometer. Carter's thermometer. This Carter's thermometer, what does it do? It does measure cooling power of air. It measures cooling power of air. Okay, fine. Cooling power of air includes three things. Okay, air temperature, humidity. Humidity means moisture in the air. Okay, air temperature, humidity and air velocity. These three things. Okay, Carter's thermometer measures cooling power of air. Cooling power of air. Okay, fine. Now, so what is the other use? I think 2021, I think the question was there. What is the other use of Carter's thermometer? So other use of Carter's thermometer is it measures low air velocities. It measures low air velocities. Okay, low air velocities it will measure. It measures low air velocities. Okay, fine. Now, okay, fine. Low air velocities. So what is the instrument that measures humidity? Humidity is measured by hygrometer and psychrometer. Okay, these are the instruments that can measure humidity, guys. Okay, hygrometer and psychrometer, it can measure. Okay, fine. This globe thermometer measures mean radiant temperature. These two things together called, okay, mean radiant temperature and cooling power of air. Okay, and cooling power of air. These two things together, they are called as corrected effective temperature. Corrected effective temperature. Okay, corrected effective temperature. Okay, fine. So I make clear, this is mean radiant heat. Okay, and cooling power of air, this is called as corrected effective temperature. Okay, fine. Before going to the next question, how much level of noise is acceptable? Only one point related with the noise I am going to discuss. What is noise level? Acceptable limit. Acceptable. Okay, how much noise level is acceptable, guys? Okay, acceptable. How much noise is acceptable? Yes, how much noise is acceptable? Yes, 85 decibels, guys. Not 80. Okay, 85 decibels. Okay, 85 decibels is acceptable. At 90 decibels and all, you will develop auditory fatigue. And 100 decibels, and 100 decibels and all, you will have temporary deafness. Okay, around 160 decibels, the rupture of tympanic membrane can happen. So this is what noise. Okay, noise is 85 decibels. MCQ point is 85 decibels. Okay, fine. Next question, guys. Okay, what is this trickling filter method is used at where? This question is related with sewage. Okay, sewage. So sewage, if you take sewage and sullage, we have two terms are there. Sewage means wastewater with excreta. Wastewater with excreta, that is sewage. What is sullage is wastewater without excreta. Okay, without kitchen water. So kitchen water is more of sullage. Okay, fine. Now, so what does this, how to measure sewage? What will happen is, usually the sewage will go to sea, river, okay. But ideally we should do purification, okay. Sewage treatment plant it should go, then it should go, after that only it should go to the final disposal. A sewage disposal, it contains, how will you measure the strength of sewage? Strength of sewage is measured by BOD, biological oxygen demand, and suspended solids, guys, and suspended solids strength. Okay. Second, how much is the organic load? Organic load is measured by COD, chemical oxygen demand. BOD, biological oxygen demand, measures the strength of sewage. Organic load, how much organic load is there? That is measured by this COD, chemical oxygen demand. Okay, fine. Now, what happens in the sewage treatment plant? What happens in the sewage treatment plant? First is sewage will go to, okay, some metallic screens will be there. Metallic screens. Okay, then it goes to grit chamber. Okay, it goes to grit. Metallic chamber, metallic screens will remove this any hard substances. Wood is there, dead animal is there, that will be taken out. Grit chamber. After that it goes to primary sedimentation tank. Primary sedimentation tank. Primary sedimentation tank it goes. Okay. So all these three, this is called as primary treatment. All these three, this is called as primary treatment. The sewage treatment plant, this is primary treatment. Okay, fine. Okay. Second, sorry, my voice is having a problem. Okay, fine. Now, after this, it goes to either it will have two parts will be there. Trickling filter method. Okay, one is trickling filter method or activated sludge process. Activated sludge process. Okay, activated sludge process. Then it goes to final sedimentation tank. Then it goes for final sedimentation tank. Okay, final sedimentation. These two together are called as, okay, what is the function of where alum in where which one? Okay, rapid sand filters we can add. Okay, drinking water we will do that. Alum we will add. Chemical pre-treatment. So this is trickling filter or final sedimentation tank. This is called as secondary treatment. This we call it as secondary treatment. Secondary. Okay, secondary treatment. So am I clear? So this is primary treatment and secondary treatment. After that, this goes for final disposal. It may be a river or it may be a sea. Okay, so the coastal Mumbai and all, they will send the sewage to river. Chennai they does it. Okay, maybe Delhi, other places they will have a sewage treatment plant. They will have. Okay, sewage treatment. Maybe it goes for a land or the river also they will send it. Okay, fine. Now, so am I clear? Now we will come back to the question. What is the answer for this question? What is the answer for this question? What is the answer for this question? Yes. Trickling filter method is used in, where will you use this trickling filter method? Answer this question, guys. Yes. Trickling filter method, it is in the secondary treatment, guys. Okay. So we mostly use this activated sludge process we use. Okay. Previously we used to have the trickling filter. So nowadays we have this modern sewage treatment plant. We use this activated sludge process. Activated sludge process. Okay, fine. Are you able to follow this, guys? Yes. We completed, I think, environment we have completed. Yes, able to follow this. Shall I go to the next area? Put it in the group. Put it in the chat box. Are you able to follow this? Yes or no? Yes. Fine. Okay. We'll go to the next concept, guys. We'll go to the next concept. Communicable diseases are usually asked, man. Communicable diseases are usually asked. So we divided communicable disease today as well as tomorrow. Okay, fine. 1 hour communicable disease you will see. Okay, fine. Now, what is the answer for this question, man? Incubation period of measles. What is the answer for this question? So if you take measles, okay, so measles, what are the points we should know? Okay, there is no carriers. Okay, there is no carriers. Okay, fine. What other points we should know? Period of communicability is 4 days before and 4 days after. After the rash. 4 days before the rash and 4 days after the rash. Okay, fine. Next. What other points? One attack, lifelong immunity. Lifelong immunity. Okay, lifelong immunity. Okay, what other points? Okay, it contains, okay, so pathognomonic feature of this measles is Koplik spots. Koplik spots. Recently also they asked this question. Okay, on the buccal mucosa, spots will be there. On the buccal mucosa, we have this spots, bluish white lesions will be there. Now the question is when it will appear. Before the appearance of rash or after the appearance of rash. Koplik spots, when it will appear? They appear 1 to 2 days before rash. Okay, it will appear 1 to 2 days before rash. 1 to 2 days before rash. What type of rash you will get? You will get maculopapular rash. Okay, maculopapular rash you will get. Okay, maculopapular rash. First, where it will appear? It will appear retroauricular, behind the ear. Okay, fine. Now, what is the most common complication? Most common complication in measles, what you can get is otitis media. Okay, otitis media. So, otitis media is the most common complication. Otitis media. Otitis media is the most common complication in measles. Okay, fine. Now we will come back to the question. Question is incubation period. Incubation period is 10 to 14 days. Incubation period is 10 to 14 days. So 10 days for fever, 14 days for rash. 10 days for fever. One scenario based question recently asked. So we give the vaccine when we give measles vaccine. So we give vaccines at 9 months, again at 16 to 24 months. Okay, so there is one question recently asked. Okay, the baby is between 6 to 9 months child, baby. During epidemic, everywhere there is a case of measles is there. Mother is bringing the child to you. Mother is bringing the child to you. And they are asking that you do something. Everywhere there is a case of measles. So you do something. Okay, fine. What will you do? Yes, you have to vaccinate. Okay, you have to vaccinate. Vaccinate the baby. Vaccinate the baby. Vaccinate the baby. But you have to revaccinate after 9 months. Revaccinate after 9 months. Okay, and what is the minimum gap between the 2 doses of vaccine? What is the minimum gap? What is the minimum gap between 2 doses of vaccine is? Always remember 6, 10, 14 weeks. So 6 weeks, 10 weeks and 14 weeks. Okay, so the minimum gap is what? Yes, it is 4 weeks. Minimum gap is 4 weeks. So these are the points we should know regarding measles, guys. These are the points we should know regarding measles. Okay, lower molar tooth, guys. Lower molar tooth. Answer this question, man. Answer this question. Yes. Answer this question. Yes. So this is a case of diphtheria. Okay, so membranous patch is there. This is a case of diphtheria. So what is the answer? Which among the following statements is false? The question is false. Okay, the question is false. Okay, fine. So we'll go one by one. It is administered on the anterolateral aspect of thigh. Whether it is penta or DPT. Of DPT, all IM injections we have to give it in the anterolateral aspect of thigh. Okay, anterolateral aspect of thigh. No vaccination should be given in the gluteal region. Okay, fine. Diphtheria toxoid dose in adult is much lesser. Okay, fine. The DT is having the dose is very less actually. 2 Loeffler units for adult for pediatric case is around 25 Loeffler units. So this is also right. Okay, fine. Cellular but not recommended. Okay, this is also right. Okay, DPT vaccine. How long will you give the DPT vaccine? DPT vaccine will give till 7 years, not more than that. That is also right. Okay, fine. Next. A prior adverse reaction with temperature above is a contraindication. Okay, so I'm not sure what does it mean. So for a DPT, the only contraindication is okay. So we should not give more than certain age. We should not give, and also we are having some. This we have seen that hypotonic, hyporesponsive episodes. We have seen one. Then we have seen persistent, inconsolable screaming. If these things are there, one AEFI is there means next dose is contraindication. Okay, fine. So we'll go this next question. We will see regarding diphtheria. What are the other points we should know regarding diphtheria? Diphtheria. The first point is that the main source. The source is carriers. And will immunization prevent carrier status? No. Immunization does not prevent carrier status. Okay, does not prevent, because what is the vaccine we are giving? The vaccine which we are giving is toxoid. It has no effect on the organism. So the immunization does not prevent carrier status. Okay, fine. So if you are seeing a case, incubation period of 2 to 6 days, what is the treatment for diphtheria? If you see this type of case, first you have to give penicillin. Second, you have to give antitoxin. Okay, penicillin and antitoxin. This is for cases, guys. This is for cases. What about carriers? Carriers, the drug of choice is, what is the drug of choice is erythromycin. Okay, only 2 conditions we use erythromycin, carriers here, and treatment of pertussis. We use, and otherwise we can use it in carriers. Erythromycin we can use. Okay, I think few years back we had one question in diphtheria. It's a scenario based question. Mother brought a child to the hospital. The child was playing with the neighbor's child. The neighbor's child has developed diphtheria. So mother is asking, do something. Okay, so I'm repeating again. The mother is bringing a child. Scenario based questions we will get. So the mother is bringing a child to the hospital. The child is now, the child was playing with the neighbor's child. Neighbor's child has developed diphtheria. So do something. So you have to expose the child. This is an exposed child. So you have to ask the vaccination status. When was the vaccine given? Okay. When was the vaccine given? So vaccine less than 5 years. Previously it was 2 years actually. Less than 5 years. Less than 5 years means nothing is required. Last vaccine when the child has taken for diphtheria. Less than 5 years means nothing is required. More than 5 years means 1 dose is required. And third scenario is unimmunized. So unimmunized means what you are supposed to do? Unimmunized means, okay, one you have to give penicillin. Second, antitoxin. You have to give 2 doses at a time interval. And fourth is you have to observe the child. Okay, this you have to do. Okay, this is what? Erythromycin, and this you have to observe the child. Okay, so am I clear? This is an exposed child. Exposed child is coming to the hospital for the coming means you have to ask the immunization status. When was the vaccine taken? This is immunization status. Okay, fine. So am I clear? Okay, fine. Yes or no? Shall I continue, guys? Okay, fine. Which of the following is not true about influenza? Shall I continue? Which of the following is not true about influenza? So here we are talking more of H1N1. Okay, more of H1N1. Okay, fine. So we'll go statement wise. Influenza the main reservoir. Reservoir means where multiplication happens. Birds and pigs, guys. Birds and pigs. Birds and pigs. Okay, fine, fine. Okay, from where, what is the source for us? Source is a case. Source is a case. So what are the statements we'll go? Affects all ages and both sexes, that is right. Okay, it's a old question. This is also a right. 18 to 72 hours. Okay, that is also a right. Pandemics are common. Okay, it has caused so many pandemics. Okay, so it caused Spanish flu. Okay, Hong Kong flu. Okay, so 1918 it caused, 1957 it caused, again 2008 it caused. Historically it caused a lot of pandemics. Okay, why pandemics happen? Pandemics happen because of antigenic shift. Antigenic shift happens. Okay, because of this there is a genetic reassortment happens. The genetic reassortment will lead to pandemics. Okay, what is the point here is asymptomatics are not rare. Okay, asymptomatics are common. Asymptomatics are common. So what is the investigation we do? What is the investigation we do? So investigation is RT-PCR. If somebody is found to be positive, what is the drug of choice? Drug of choice is oseltamivir. We call it as Tamiflu. Tamiflu is also there. So that is also taken. The Tamiflu. Tamiflu, oseltamivir is the same. One more drug we have, that time we don't use it. Zanamivir. Zanamivir. Okay, Zanamivir we can use. Zanamivir. Okay, fine. Oseltamivir and Zanamivir. Okay, next. Next is, what about, suppose during 2008-9, there was vaccines available. Okay, fine. Suppose again there is an epidemic is coming right now. Can we use those vaccines now? Will it be useful? Will it work? Will it work? Yes or no? It won't work, guys. Okay, it won't work because of antigenic shift. So 2 years back NEET question is, for which condition we have to prepare vaccine regularly? Okay, for this condition, vaccine prepared every year based on new strain. For which condition we prepare vaccine? Vaccine is prepared every year based on new strain. Okay, new strain. Okay, this is about, okay, influenza. One more flu is there called as bird flu or avian influenza. What is the strain for bird flu? Bird flu is H5N1. Okay, H5N1. Recently also we had some cases of bird flu. So if any, for treatment purpose, for humans it is again oseltamivir. For birds it has to be culled. We kill them all. Okay, fine. Okay, this is about influenza. Okay, so answer this question, guys. A 10 months old child was brought to a PHC with a history of cough and cold. On examination, he has a respiratory rate of 58. So no chest indrawing. He is probably suffering from. What is the answer? What is the answer? Yes. Yes. For this condition, we have to follow IMNCA guidelines. Okay, we have to follow IMNCA guidelines, Integrated Management of Neonatal Childhood Guidelines. So if any child comes to hospital, what we have to do? First, we have to assess the child. Assess. Okay, fine. Then what are the things we have to assess? We have to assess what? First is respiratory rate we have to see. Fine. Second, we have to look for chest indrawing we have to see. Chest indrawing. Third, we have to look for whether the child is having danger sign or not. Danger sign. Whether the child is having danger sign or not. Okay, fine. Now, so chest indrawing you will look during in this lower chest. IMNCA guidelines, we will see program tomorrow. IMNCA usually the age group is 0 to 5 years. Okay, 0 to 5 years. So if respiratory rate, okay, so respiratory rate, okay, if it is 0 to 2 months child, if it is more than 60 means it is fast breathing. Okay, we are going to call it as fast breathing. Okay, 2 to 12 months child, it is more than 50. Okay, fine. 1 to 5 years, it is more than 40. To call it as fast breathing, but to call it as fast breathing. 0 to 2 months more than 60, 2 to 12 months more than 50, 1 to 5 years more than 40. Okay, fine. Danger signs, what are the danger signs we have to see? So the danger signs we have to see: first stridor, convulsions, okay, so not able to feed, not able to drink, okay, those things are danger signs. Okay, fine. Now, so next you are going to classify them into three categories. Okay, so no fast breathing, short form I will write, no chest in drawing, no danger sign. So nothing is there. Okay, so this we are going to call it as no pneumonia. No pneumonia. Okay, no pneumonia. Okay, no fast breathing, no chest in drawing, no danger sign. We are going to call it as no pneumonia. Nothing is there. So next we have is fast breathing or chest in drawing present. Okay, but there is no danger signs. No danger sign. This we are going to call it as pneumonia. Okay, pneumonia. This we are going to call it as pneumonia. Okay, fine. Chest in drawing is, danger sign is present. That means it is severe or very severe pneumonia. Severe or very severe pneumonia. Okay, severe or very severe pneumonia. Okay, fine. So am I clear? So now answer this question. What is the answer for this question? What is the answer for this question? What is the answer? The child is what? No chest in drawing. But the child is having respiratory rate. What is the month? 10 months. It's more than 50, man. So this is what? Pneumonia. This is a case of pneumonia. Okay, what is the drug of choice for pneumonia? What is the drug of choice for pneumonia? Pneumonia, it is amoxicillin, guys. Okay, so no pneumonia, you are going to do symptomatic treatment. Pneumonia, amoxicillin. It's very severe pneumonia. We have to refer the child immediately. So it's a case of emergency. You have to do pre-referral treatment and referral we have to do. Fine. Shall I continue? Yes, guys, able to follow this? Pace is okay? Pace is okay? My voice, I'm finding it difficult. Yes. Pace is fine. Okay. Pace is okay. Okay, fine. Now, which of the following is false? Which of the following is false regarding rubella infection, man? False regarding rubella infection. False regarding rubella infection. Okay, fine. Now, the question is false. Okay, false. Okay, false. Now, what are the points we should know regarding rubella? Rubella is caused by this toga virus. Rubella is caused by this toga virus. Okay, fine. So what is the use of what it will do? Okay, so rubella, the period of communicability is 1 week before, okay, and 1 week after. Okay, 1 week after. So 1 week before, so 1 week after, 1 week after. Okay, fine. Yes. Now answer the question. Okay, 1 week before and 1 week after. So rubella mainly in general adults, it will not cause much. It will not cause much. Okay, it will cause rash. But what we are worried about rubella is congenital rubella syndrome. Congenital rubella syndrome. Okay, what comes in congenital rubella syndrome? If mother is exposed, okay, what are the components of congenital rubella syndrome? So it has 3 components. It will be there. Congenital rubella syndrome. Okay, one is that cataract will be there. Okay, second, sensory neural hearing loss. SNHL I will write. Sensory neural hearing loss. Third is PDA. Patent ductus arteriosus. Patent ductus arteriosus. Okay, fine. So if mother is in which trimester means there is more risk of having this component. If the mother is in first trimester, okay, there is more chance of congenital rubella syndrome. 12 to 20 weeks, so approximately 20 weeks you will get, baby can get deafness. More than 20 weeks, no major abnormalities. Okay, no major abnormalities. More than 20 weeks means, okay, no major abnormalities. Okay, fine. This is congenital rubella syndrome. More than 20 weeks means no major abnormalities. No major abnormalities. Okay, fine. So am I clear? Now, usually it is given to whom? Usually it is given for children. Children we give. Suppose a woman in the reproductive age group, they come to you. So what is the advice you have to give? Okay, advice for women in reproductive age group. Women in reproductive age group. Reproductive age. So what is the advice we have to give? What is the advice? So what advice we have to give? You have to tell them, okay, reproductive age group, what advice you have to tell them? If you are giving the vaccine, we are talking about the vaccine, man. We are talking about the vaccine. Okay, vaccine. So what you have to tell regarding vaccine is that, okay, avoid pregnancy for 3 months. Okay, you have to tell her that avoid pregnancy for 3 months. 3 months. Okay, 3 months. So what is the answer for this question? Okay, it's a droplet infection. This is true. Vertical transmission is possible. Okay, so late pregnancy, this is also true, but early pregnancy is not milder form, guys. Okay, it forms severe form. Okay, fine. Severe form. Late is severe form. Okay, fine. So am I clear? Okay, so before going into this, we will see some match the following, man. Okay, fine. Can you see this match the following? Okay, can you able to see match the following? Yes. Okay, you can able to see the match the following. There is risk is there, man. Risk is there. The vaccine, it's a live vaccine. So the live vaccine can affect the fetus. Okay. So there is a risk is the RPR channel. There is a risk is there. Okay, fine. So can you able to see this this one? Now can you able to see this? Is it not visible? Okay. Statement wise we will come. Statement wise we will come. Okay, fine. Instead of match the following, we will see. So incidence cannot be calculated in which study? Case control or cohort study? So that's what I want. Incidence. Incidence you can't find it in a case control study. Okay. So incidence. Okay. Incidence. Okay. No incidence in a case control study. Why? Some salient points only I want to say. So no incidence in a case control study. Case control before because the study has already, before the start of study, both outcome and exposure has already occurred before the start of study. Okay, fine. Age and sex. What is age and sex? Age and sex are the common confounding factors. Okay, I am giving some points, man. I am just giving some additional points in epidemiology. Okay, risk ratio can be calculated. Risk ratio is the other name for what? For cross product ratio we said that is odds ratio. Risk ratio is the other name for what? It is the other name for relative risk. Risk ratio is the other name for relative risk. Which study can calculate risk ratio means? Cohort study. Fine. Which one will give you the magnitude of health problem? This we have already seen. Prevalence will give you the magnitude of the health problem. Which one will give you the natural history of disease? Natural history of disease is given by incidence. Which study is incidence? Okay, hospital based studies, come on. Hospital based studies will give you what? We already seen hospital based studies will give you bias, Bergsonian bias. Okay, Bergsonian bias for hospital based studies. Cause preceding the effect. Okay, cause preceding the effect. Okay, first cause आना चाहिए, उसके बाद effect has to come. What is this called as? What is this called as? This we call it as temporal association. Okay, temporal association. Temporal association. Cross preceding the effect is temporal association. Okay, fine. Fine. Next. Time is involved. Okay, those things I'm leaving, man. What is time is involved? Time, if it is there, it is rate. Understand? Time. Okay, infant mortality rate, crude birth rate. Okay, specific death rate. Anything is there. If rate means, to call it as the rate means time should be there. Time should be there. If time is there, then it is rate. Okay, fine. Okay, RCT. Okay, RCT. Okay, what is Kaplan-Meier method? This is the another way of survival analysis. Survival analysis. Okay, survival analysis is Kaplan-Meier method. Survival analysis, which is considered as the heart of RCT. Heart of RCT means, heart of RCT is what? Randomization. Randomization is considered as a heart of RCT. Heart of RCT. Next. Next. These things are now. Hollow endemic is what? So endemic mostly in children. Mostly children are affected. Mostly children. Hollow endemic means mostly children are affected. Children are affected mostly. Hollow endemic means mostly children are affected. When will you say that area free of epidemic? This is the statement we will see. What is this statement is? No new cases for twice the incubation period means area free of epidemic. Okay, area free of epidemic means no new cases for twice the incubation period. Okay, so no new cases. Okay, suppose to call it as India COVID free. So how will you call it as COVID free means? Okay, so what is the incubation period of COVID is 2 to how much? 2 to 14 days. So to call COVID free you have to tell means okay, which no case for 28 days. No case for 28 days. No case for 28 days. Okay, fine. So am I clear? Am I clear? Able to follow this, guys? Yes or no? Able to follow this? Yes or no? Able to follow this? Able to follow? Yes. Fine. Okay. So we'll continue here. So hopefully this is clear. We'll continue. We'll go back there. We'll go back there to the questions, guys. We'll go back to the questions. Okay, fine. Okay, answer the question, guys. Okay, answer the questions. Yes, fine. A male patient diagnosed with TB took complete treatment. The first sputum examination was done after completion of intensive and continuation phase is found as what? What is the status of this patient? Okay, fine. This is NTEP. We call it as the program is National TB Elimination Program. So according to this program, okay, so what we are doing it, okay. So our goal is to eliminate. RNTCP has become National TB Elimination Program. So eliminate TB by 2025. Eliminate TB by 2025. We are supposed to eliminate TB by 2025. Okay, fine. So what is the case definition for TB? Okay, so anyone coming with fever. So anyone coming with fever. Okay, fever for more than 2 weeks, cough for more than 2 weeks, and you have loss of weight is there. Okay, so fever more than 2 weeks, cough more than 2 weeks, loss of weight is there. Loss of weight is there. Then we have night sweats are there. Okay, so night sweats, hemoptysis. If these features are there, means we have to rule out TB. So what is the this one we are going to take? We are going to take 2 sputum. We are going to take 2 sputums. We are going to take. Okay, 2 sputum plus. Okay, we are going to take 2 sputum and we are going to do chest X-ray. Okay, chest X-ray. If there is, if sputum is positive, we are going to call it as TB. But if there is inconclusive evidence, we can go for CB-NAT. Okay, so CB-NAT, cartridge-based nucleic acid amplification test. Okay, fine. If it is there, then we can sputum plus chest X-ray, we can do it. So CB-NAT is positive or sputum is positive. Okay, we are going to call it a case of TB. We are going to call it a case of TB, right? So what is the treatment for TB? Okay, so treatment for TB, we have, what is the treatment available? Treatment for TB. So currently we have only one category available, category 1. So we have 2 phases will be there, intensive phase and continuation phase. So we have treatment available. What is the treatment? 2-HRZD, 4-HRE. So 2-HRZD and 4-HRE. This is the treatment available currently for TB. Okay, so what is the new regarding treatment is? Treatment is daily treatment. One is treatment, daily treatment. We have these 99 dots. Okay, so we have these 99 dots. Okay, so TrueNAT we use it for this one, guys. Okay, so MDR TB finding. So we are trying that also. So 99 dots, what is 99 dots? It's a way of monitoring the TB treatment. Okay, fine. So patient has to give their registered mobile number. So they will give the treatment cards to them. Okay, what they will do is that the back side of the treatment pouch, there will be a toll-free number will be there. From your registered mobile number, you have to call them. Okay, that means what? That means that you have taken the tablet. Okay, and every day there will not be same toll-free number, different numbers will be there. It's a way of we are mixing the technology in the treatment actually. Okay, it's good for the patient and we are utilizing it. And in the city itself, from a headquarters itself, we can check whether all the patients have taken or not taken the drug. If they are not taken the drug, means what we can do? We can send a SMS or we can call them, we can send people to them. Okay, fine. So this is 99 dots, fine. So next we have this Nikshay Poshan Abhiyan we have. Nikshay Poshan Abhiyan. So where we provide nutrition allowance of 500 rupees per month during treatment time. So directly into their account itself, we will be putting money of 500 rupees during the treatment period itself. We are doing it. Okay, this is Nikshay Poshan Abhiyan, guys. Nikshay Poshan Abhiyan. Okay, fine. So you may be asking, when will you test for sputum? Okay, whether the treatment is working or not working, how will you know? So for that purpose, what we will do is that we will do follow-up sputum when we will do end of IP, end of CP. Okay, end of CP. Yes, 500 rupees per month. 500 rupees per month you will provide. So end of CP, IP and end of IP. So what is the treatment you are going to provide here? How much, so what is the result? Okay, both are negative. You are going to call this person as cured, guys, cured. Okay, CP means continuation phase, IP means intensive phase, CP means continuation phase. Both are negative. Okay, if one positive, other negative, or okay, so this we cannot call them as cured. If both are cured, we can call the other one as treatment completed. If both are negative, two consecutive sputum are negative, means we are going to call them as cured. Okay, this is what the question is. This is what the question is. Okay, fine. This is what the question is. Okay, so both sputum is negative. What is this? This we call it as cured. Okay, fine. So am I clear? So this is about the treatment of TB, guys. This is about treatment of TB. Okay, fine. What is MDR TB means what? They are resistant to what? That is also last year NEET question. MDR TB means HR resistance. Okay, isoniazid and rifampicin resistance, HR. What is XDR TB means? What is XDR TB means? Okay, resistant to HR, then fluoroquinolones and one injectables they are resistant. Okay, fine. What is the answer for this question, guys? What is the answer? What is the answer for this question? Yes, sustainable development. Okay, they have given on target. What is the answer for this question? What is the answer for this question? What is the answer? Okay, fine. Yes. The sustainable development goals. Okay, fine. Look here. Okay, all the countries in the world under the leadership of United Nations. Okay, under the leadership of United Nations. Okay, under the leadership of United Nations. Initially, they accepted some goals called as MDG, guys. MDG, Millennium Development Goals, and this is from 2000 to 2015 Millennium Development Goals. Then in 2016 we accepted some other goals called as SDG from 2016 to 2030. All the countries in the world, they have to they have to achieve these goals. Okay, fine. So in SDGs we have how many goals are there? Means we have 17 goals are there. 17 goals. Out of this, only one goal is directly related with health. Okay, goal number 3, it is related with health. Okay, it is related with health. Okay, healthy lives. Okay, so that is the goal number 3. So for that, it has certain targets. It has certain 9 targets are there. We'll see the first 3 targets. You will see. First is target 1, that is 3.1, that is we have to bring the MMR to less than 70 per 1 lakh. 70 per 1 lakh live births, guys. Okay, so we have to bring the target of MMR should be less than 70 per 1 lakh. Okay, fine. The second is that target 1, 3.1. 3.2 is that we have to bring neonatal mortality rate to less than 12 per 1000 live births, and under 5 mortality rate should be less than 25 per 1000 live births. Okay, fine. Third one is we have to eliminate. Okay, eliminate. Okay, TB, HIV, malaria. So all these conditions we have to eliminate, guys. Okay, all these conditions we have to eliminate. So MMR is target should be less than 70 per 1000. Okay, so 3.2 is NMR should be 12 per 1000, and MMR is 1 lakh actually, and under 5 is less than 25 per 1000, and 3.3 eliminate TB, HIV for malaria, guys. Okay, malaria. Okay, fine. So the question for answer for this question is this one, less than 70. Ours is nearly 103, I think. Okay, so the last value we had is 103. MMR is less than 103. Okay, 103 we have. Okay, fine. In India, what is the mechanism to achieve this SDG? In India, we have a system called as Indian government established NEET Ayog. What is NEET Ayog? NEET Ayog means National Institution for Transforming India. National Institution for Transforming India. Actually, it replaced something. Okay, so this is the think tank. Okay, that helps us to achieve these goals. So this replaced something. It replaced what? It replaced Planning Commission. It replaced planning commission. Okay, it replaced planning commission. Okay, fine. So planning commission used to be there since 1950s. Okay, if every 5 years they will make a plan. So this actually replaced the planning commission. It replaced. Okay, fine. So answer for this question is 70 plus 70. Fine. Okay, fine. We'll go to the next question, guys. We'll go to the next question. Next question. Which of the following is true about zinc supplementation, guys? Okay, which of the following is true about zinc supplementation in ADD, acute diarrheal disease? Which of the following is true? Before going into that, first we will see ADD, acute diarrheal disease. Okay, we'll follow ADD. What is acute diarrheal disease? Okay, acute diarrheal disease. So any child with diarrhea, what we are supposed to do? Any child with diarrhea, what we are supposed to do? Any child with diarrhea, we have to follow this IMNCA guidelines, guys. IMNCA guidelines we have to follow. Okay, so what is the age group? 0 to 5 years. 0 to 5 years, we have to follow this IMNCA guidelines. In IMNCA guidelines, any child with diarrhea, what are things? We have to rule out dehydration. Okay, what are the things we will see? First, you will look for general condition. General condition. Then you will look for sunken eyes. Okay, general condition you will see. Second, you will look for sunken eyes. Then you will offer water to the child. You will offer water to the child. Okay, fine. Then you will do the skin pinch test. Okay, you will do the skin pinch test. Okay, fine. The general condition is normal. Sunken eyes, no. Thirst, not increased. Skin pinch test is normal. You have to pinch it and you have to leave it. Where will you pinch? Where will you pinch? Okay. So not in the cheeks. You have to pinch it in the abdomen. You have to pinch it in the abdomen. Okay, fine. Now, general is restless. Okay, and irritable. Some of you may be restless right now in the sitting here. Irritable. Sunken eyes, yes. Thirst, increased. Baby is eagerly drinking water. If you offer water, baby is drinking eagerly drinking water. Skin pinch test takes less than 2 seconds. Okay, skin pinch test takes less than 2 seconds. Okay, fine. Now, out of, if nothing is there, the first one we call it as no dehydration. Okay, no dehydration. This we call it as some dehydration. Some dehydration. Out of 4, if any 2 is there, is also fine. Any 2. Okay, any 2. Any 2 is there also fine. Out of 4, if any 2 is there, fine. So next is restless, irritable we have seen. Next is general condition. Next is the child is lethargic. Okay, or unconscious. Lethargic or unconscious. Sunken eyes present. Thirst increased. Thirst is not able to drink. Okay, not able to drink. You pinch it, it takes more than 2 seconds, guys. It takes more than 2 seconds. Okay, fine. This we call it as severe dehydration. If any 2 is also fine. Out of 4, if any 2. Out of 4, if any 2 is there, that is also fine. Okay, if any 2 is there also, that's fine. Okay, fine. So, is it clear? Now tell me, what is the treatment here, guys? What is the treatment for no dehydration? What is the treatment for some dehydration? What is the treatment for severe dehydration? Severe dehydration. For no dehydration, you are going to go with home-based fluids. For some dehydration, you are going to go with what? Home-based fluids means what you are asking. Okay, home-based fluids means rice water, dal water. Okay, those are home-based fluids. Tender coconut. Okay, some dehydration, you are going to go with what? Some dehydration is you are going to give ORS. Severe dehydration, you have to give oral, guys. Okay, ringer lactate. Oral we can give. Ringer lactate we can give. Okay, fine. Oral. Severe dehydration, we have to give oral. Along with these, any child with diarrhea, we will give zinc also we will give. The question here is, What is the purpose of giving zinc? That is the question. What is the purpose of giving zinc here? We will go to this. Okay, fine. What is right here is the purpose of giving zinc here is the incidence. It reduces the incidence of diarrhea in the following 2 to 3 months, guys. Okay, following 2 to 3 months, it reduces the incidence of diarrhea. Okay, fine. Now, what is the points we should know here? So, less than 10, less than 6 months. Okay, so you have to provide less than 6 months. This has to be 10 milligram we have to give. More than 6 months we have to give 20 milligram for 10 to 14 days, guys. Okay, 10 to 14 days. This is how we have to give. This much we have to give. Okay, fine. It reduces the incidence of diarrhea in next 2 to 3 months. Okay, that is why we give 10 to 14 days. Fine. Okay, all are true about pulse polio except, okay, what is wrong here? Pulse polio. Okay, all are true. What is wrong regarding pulse polio? Fine. Okay, look here. Pulse polio. Okay, so India is having the highest case of polio in the entire country. So in the entire world actually in early 90s. So we started this pulse polio in 1995. We started 1995. So to reduce the case of pulse polio, we started this. We reduced the case of polio. We started this pulse polio in 1995. So what we did? So what we are supposed to do? Pulse polio, all children less than 5 years. Okay, to be vaccinated. Okay, to be vaccinated. On which day? We have a day called as National Immunization Days. We celebrate National Immunization Days. All children less than 5 years to be vaccinated, irrespective of their previous immunization status. So usually we celebrate this 2 days. We will celebrate. Okay, in the month of January, February, March. Right from Kashmir to Kanyakumari. So all children to be vaccinated irrespective of the previous immunization status. This is one activity. Okay, fine. So second activity what we did here is called as not part of this one. The second activity what we did, we called as AFP surveillance. What is AFP surveillance is, so any child with acute flaccid paralysis. Okay, any child with acute flaccid paralysis. Okay, so we have to do stool examination. Okay, the only way to confirm polio is by lab investigation. There is no other way. Okay, you cannot confirm a case of polio. Any child with acute flaccid paralysis, what is the age is? Age is less than 15 years. Any child with acute flaccid paralysis, you have to collect stool examination, guys. Stool. So take 2 stools examination. 2 stools you have to collect 24 hours apart. Within 14 days of onset of paralysis, you have to take 2 stools 24 hours apart. Within 14 days of onset of paralysis, send them to where? You have to send the stools to National Institute of Virology, Pune. You can send. This is how we can find. This is the activity we did. This is what activity 1 we did. The other one is that we did pulse polio. With these 2 activities, we were able to reduce polio, and there is no case of polio in India since 2011. So India is considered certified as polio free, guys. India is considered certified polio free since 2014, guys. 14. So what is the answer for this question? What is the answer for this question? You send the stools in cold chain, that we call it as reverse cold chain. That is also fine. What is the answer for this question? For other purpose, it's okay. For here, for minimum 4 weeks, it's not here, guys. For other purpose, it is fine, but not for this one. There should not be any minimum of 4 weeks, not applicable for this condition. Okay, fine. Okay. This is a vector-borne condition. Okay, so we will go some images we will see. Okay, fine. Before going into this, we'll see some images, guys. We'll see some images. Okay, fine. What is this mosquito, guys? What is this mosquito? What is this mosquito? Fine. What is this mosquito? What is this mosquito? Yes, this is Anopheles mosquito. Sometimes you are getting some images question, so we should be ready for it. Yes, this is Anopheles, guys. This is Anopheles. This is Anopheles mosquito. Okay, this is Anopheles mosquito. Okay, fine. So okay, Anopheles. This is Anopheles. What is this? This mosquito sits with an angle. Okay, this is the only mosquito that sits with an angle to the surface. No other mosquito sits with an angle. Okay, this is the only mosquito that sits with an angle. Okay, the wings are spotted. It has this spotted wings will be there. It has this spotted wings will be there. Spotted wings. Okay, fine. And what is the disease it transmits? In India, it transmits malaria, guys. Okay, malaria. Okay, in India, it transmits malaria. So it sits with an angle, spotted wings, it transmits malaria, guys. Malaria. Okay, fine. What is this mosquito? This mosquito exhibits hunchback. This is Culex. Okay, exhibits hunchback. Hunchback, no stripes. There is no stripes. There is no stripes. Hunchback, stripes present. Okay, this is Aedes, guys. This is Aedes. Okay, Aedes. What is the disease it transmits? Culex breeds in dirty water. Culex breeds in dirty water. Okay, so Aedes breeds in artificial containers. Okay, Aedes breeds in artificial containers. Okay, artificial containers. Aedes breeds in artificial containers. It breeds, guys. Okay, it breeds in artificial containers. And what is the disease it transmits? You can remember like dry chicken Zika. Okay, that's how I remember. You can find your own way. Okay, dry chicken Zika. Okay, D stands for dengue. Rift Valley fever. Rift Valley fever, yellow fever. Okay, chikungunya. Okay, chikungunya. It transmits chikungunya and Zika virus. Zika virus. Okay, fine. It breeds in artificial containers. This is what is this? Aedes, guys. Aedes. Okay, fine. Aedes. Artificial containers. Next. Okay, fine. You can find your own way. Okay, whatever way you can remember. Zika was recently asked. Okay, fine. Yes. What is this one? Yes, this is sandfly. Okay, sandfly. So what is? It's a hairy insect. It's hairy, smaller than mosquito. Okay, it is hairy. It's smaller than mosquito. What is the disease it transmits? It transmits Kala Azar. Okay, oriental sore. Okay, it transmits Kala Azar and oriental sore. Kala Azar and oriental sore. Oriental sore it transmits. Okay, fine. What is the next one? Heart tick. Okay, what is the next one? Heart tick. What is the disease it transmits? Heart tick. So if you take heart tick, okay, so the head will be visible. Okay, head visible. There is a hard substance in the back, scutum present. Okay, scutum present. So what are the disease it transmits? It transmits tularemia. KFD it transmits. Babesiosis it transmits. So KFD, tularemia, babesiosis it transmits. Okay, this is heart tick, guys. This is heart tick. Heart tick. Okay, fine. Yes. This is soft tick. The next one is soft tick. Soft tick. Soft tick head is not visible. Head not visible. Okay, head not visible. So what is the disease it transmits? You can remember Q fever and relapsing fever. Okay, Q fever and relapsing fever. Okay, Q fever and relapsing fever. Okay, fine. So am I clear? Yes. These are some of the images, guys. These are some of the images we should know. Okay, for the exams. Okay, fine. 3 more questions are there. We will finish it. Then we will 4 questions we have. Okay, fine. Which are the following is true about JE, guys? Which are the following is true about JE? Okay, fine. In India, JE is caused by flavivirus. Flavivirus. Okay, the main reservoir is pigs. Reservoir is pigs. They are the main reservoir. Birds and pigs, they are the main reservoir. Next, it is transmitted by mosquito. This is Culex. This is right. This is a Culex mosquito. And one more Culex is there called as Culex vishnui. Okay, Culex and Culex vishnui, guys. Okay, these are the 2 mosquitoes. Few years back it was a question. Okay, Culex vishnui. From them it is transmitted to humans. Okay, one of the peculiar feature of this Culex is that they breed in paddy fields. It breeds in paddy fields. It breeds in paddy fields. They breed in paddy fields. Okay, they breed in paddy fields. So humans are finally affected. So usually pigs are considered as amplifiers. These are considered as amplifiers. Okay, amplifiers, and they will not show any signs or symptoms. The only animal that show features of encephalitis is, what is the only animal? Only animal features of encephalitis, horse. Horse is the only animal that shows encephalitis. No other animal will show encephalitis. Okay, it breeds in paddy fields. Horse is the only animal that will show encephalitis. There is no other animal will show encephalitis. Okay, now look at the question and answer. What is the answer for this question? The case fatality, I already told you, it is around 20 to 40%. Okay, so this is wrong, this is wrong, this is wrong. What is right is this one. Culex tritinio is the most important vector for JE. We have a vaccine available. Can you tell me what is the strain of the vaccine? What is the strain of the vaccine we give, guys? What is the answer? Strain of the vaccine. Vaccine strain. Okay, the vaccine strain what we use is SA 14-14-2, guys. SA 14-14-2. Fine. Okay. We'll go to the next question, guys. We'll go to the next question. False about dengue is the question is false about dengue. Dengue is the first point, most common arboviral infection. Most common arboviral infection, guys. Dengue is the most common arboviral infection. It has 4 serotypes are there. 4 serotypes. 4 serotypes are there. Okay. So, okay, fine. 4 serotypes. Mostly they will see this is first is right. Okay, second is also right. Okay, fine. So first is dengue is mostly undifferentiated fever. It can present as an undifferentiated, any other viral fever it can present. That is one. Second we have is classical dengue fever. Classical dengue fever. Okay, classical dengue fever. We have this classical dengue fever we can have. Classical dengue fever. Okay, fine. Third we have is DHF, dengue hemorrhagic fever. Okay, classical dengue fever is what? Classical dengue fever will be joint pains will be there. Okay, fever. Okay, all these things will be there. Okay, so severe joint pains, retroorbital pain, body pain, all these things will be there. So that is classical dengue fever. And we have is dengue hemorrhagic fever will be there. Dengue hemorrhagic fever happens why? Because of reinfection with another serotype. Reinfection with another serotype. Suppose we have 4 serotypes are there. So I am infected with one serotype. One more mosquito is coming and biting me with another serotype. Okay, then only I will have dengue hemorrhagic fever. Dengue hemorrhagic fever. Okay, fine. Fourth one is dengue shock syndrome. Patients will have dengue hemorrhagic fever with shock. Okay, fine. So now tell me what is wrong here. Okay, fine. So this is also right. The incubation period is around 8 to 10 days, guys. The incubation period is around 8 to 10 days. This is the incubation period. Okay, incubation period is 8 to 10 days. So what is the drug of choice? There is no drug of choice for dengue. So what we have for dengue is only symptomatic treatment. There is no drug of choice. Okay, so you can do less than 5 days fever, means you can do NS on antigen. 6 and more than 6 days fever means you have to do ELISA. Okay, fine. So if you start case of dengue, there is no single drug of choice. What we have is only symptomatic treatment. There is no single drug of choice. Okay, at what blood levels you will see platelet levels, you will put this platelet transfusion, blood transfusion. DHF will have thrombocytopenia will be there. Okay, at what platelet levels you will start, okay, what platelet levels you will start transfusion? On less than 10,000. Okay, then you can go for transfusion, not before that. The problem is because of reinfection with another serotype. Fine. Okay, answer this question, guys. Okay, answer this is dog bite. 2 more questions. We'll finish it in 10-15 minutes. Okay, for the treatment of class 3 dog bite, all of the following are right. Okay, fine. First point we should know is any bite, what we are going to see. First, you are going to do wound management. Okay, we are going to start with the wound management. In wound management, what we are going to do? First is running water for 15 minutes. You are going to give running water for 15 minutes. You are going to do the running water. Okay, fine. Tap, you just wash it. Okay, second what you are going to do? Second is no immediate suturing. Okay, that means that don't suture it. Okay, don't suture, no immediate suturing. So you just wait for 24 to 48 hours. Otherwise, what will happen? You will create a nerve endings. The nerve endings will affect the suture. Okay, fine. Now, okay, then you have to categorize whether the ARV is required, tetanus is required. For this purpose, we will see. So category 3 categories are there. Category 1 we will leave it. Straight away we will go to category 2, guys. For category 2, what you are going to do? Okay, nibbling. Okay, nibbling or abrasions are there without blood. Okay, nibbling and abrasions are there without blood, means you have to give ARV. Okay, you have to give anti-rabies vaccine. You have to give. Okay, but should not be having blood. If category 3. Okay, so category 3 we have this any abrasions with blood. Okay, multiple bites are there. Okay, head and neck bites are there, wild animal bites are there. So those circumstances we can go for ARV plus immunoglobulins. Okay, we have to go with ARV for immunoglobulins. Immunoglobulins for immediate protection we have to give. Immediate protection. Okay, now immediate protection. Okay, now what is the regimen available? So we have different regimen is available. First one is called as essence regimen. Okay, essence regimen means IM regimen. You are going to provide 0.5 ml. Okay, you are going to provide. Okay, so how many days? 0, 3, 7, 14 and 28 days. Okay, this is what we are going to give. 0, 3, 7, 14 and 28 days. We are going to provide. Okay, essence regimen. Okay, 0, 3, 7, 14 and 28 days you are going to provide. So this intramuscular regimen. The second one is we call it as updated thigh regimen. Okay, updated thigh regimen. Updated thigh regimen you are going to provide intradermally 0.1 ml you are going to provide 0, 3, 7 and 28 days. But every time when you are providing, you have to provide 2 sites you have to provide. Okay, you have to provide 2 sites. 2 sites you have to provide. 2 sites. So updated thigh regimen, you have to provide 2 sites you have to provide. Both sides. Okay. So first site, suppose I am giving the right arm, similarly you have to give left arm, 0.1 ml guys, 0.1 ml. So these are pre-exposure or post-exposure. These are post-exposure prophylaxis. Post-exposure prophylaxis. So immunoglobulins also you have to give. You have human and equine. Okay, so human and equine. So you have to give equine means, human means 20 international units per kg. Equine means 40 international units per kg. So half at the site, maximum you should give around the site of the bite. Remaining you can give at IM. This should be started as early as possible, not later than 7 days, guys. This should be started as early, not later than 7 days. Okay, fine. This is Essence regimen and this is updated Thai regimen. Both are post-exposure prophylaxis. That means already dog bite is there and you are going to provide after the dog bite. So then is next what we have is pre-exposure. Okay, pre-exposure prophylaxis. Okay, if you are giving pre-exposure prophylaxis, it can be given on the days 0, 7, 21 or 28 days. Okay, this is pre-exposure prophylaxis. Before the dog bite, you can give. Suppose you are having high risk job, veterinarian, okay, somewhere you are more risk of getting dog bite means you can go for it. Already vaccinated, post-exposure. Okay, already vaccinated. Okay, patient will come. Okay, sir, last year I had a dog bite. We have taken the vaccine. Okay, so already vaccinated means 0-3. What is the advantage of this 0-3 means you need not give immunoglobulins, but you can give just vaccine itself because vaccine is immediately it will start protection. That is the advantage actually, 0 and 3. Okay, fine. So am I clear? These are the points we should know. Okay, regarding this rabies and dog bite. Answer to the question, guys. Okay, fine. So what is the answer for this question? What is the answer for this question? Answer for this question is what? Immediately stitch wound under antibiotic coverage. But this is wrong. All others are right, guys. Okay, fine. All others are right. For treatment of class 3 dog bite, all others are following are right. Okay, fine. Okay, we'll go to the last question, guys. Which of the following agency provides seeds and manure in applied nutrition in schools? Okay, fine, yes. This answer is UNICEF, last year NEET question. Okay, this is UNICEF. UNICEF at older times, okay, they have supplied our schools on applied nutrition program, seeds and manure actually. What is UNICEF? United Nations Children's Fund. United Nations Children's Fund. And they have a campaign called as Gobi campaign. Okay, G stands for growth monitoring. Okay, growth monitoring. O stands for ORS. B stands for breastfeeding. I stands for immunization. Okay, this is by Gobi campaign is by UNICEF. Okay, triple F also you can add Gobi, triple F, female literacy. Okay, so food fortification, family planning, that is part of this UNICEF. And WHO, so it's a non-political international health agency. Headquarters is located Geneva. And which day we celebrated as World Health Day? So World Health Day we celebrated on 7th of April, guys. Okay, so last year it is based on environment, our planet, our health. Okay, fine. This is Geneva. Geneva is there. It's a non-political international health agency. Recently in some exam they asked this question. So SIDA, there is a Swedish international agency, they contributed for National Blindness Control Program. Okay, Blindness Control Program, SIDA. And we have DANIDA is there. International program they contributed for TB control program. Okay, TB control program. Okay, so these are the points we should know. Okay, International Health Agency. Okay, UNICEF and SIDA for National Blindness Control Program, DANIDA for National TB Control Program. Okay, fine. This is the last question, guys. Okay, this is the last question. Okay, so we'll stop with this. Okay, fine. We will see tomorrow. Remaining biostatistics, screening, other topics we have to complete it. Are you able to follow this? Can we stop it, guys? Yes or no? Fine. Is it fine? Everybody okay? We'll stop with this. Okay. So hope it was useful. Just put it your message. Any difficulties are there, you put it in this. Okay. Put it there in that group. Okay. So please put it in the comments. So that will help me to prepare for tomorrow. My voice is actually not good. Okay. So PDF I will send it, guys. Okay. Put it in the comments, guys. You put it in the comment. So tomorrow you'll see the remaining things. So you'll see all the topics. At least we covered some amount of half of the park we have covered. So tomorrow we can see the remaining things. Okay. Just put it in the group if you have any issues. Okay. PDF I will send. PDF I will send. So put it in the group. Okay. Thank you, guys. Thank you. Thank you. Any issues you let me know. Anything, any problem or any issues you let me know. So then we can modify it for next class. Next class. Okay, fine. Voice is bad little bit. Okay, we'll modify. We'll modify. Okay, fine. Yes. Thank you, guys. Thanks for listening. We will see tomorrow, guys. Tomorrow. Fine. Thank you.
हेलो हाँ जी सर एंड हो गया
बंद बंद कर लो.